School Board is called to order at 5:30 p.m. Tuesday, February 2nd, 2021, virtually in room 137 of the Edison Building, with colleagues participating electronically in accordance with Minnesota Statute 13D.01021 until further notice. Members of the public are currently not permitted to attend these meetings physically due to COVID-19 pandemic recommendations. Interested members of the public are welcome and encouraged to view this meeting remotely at youtube.com/ISD535, where the live stream video may be found. We acknowledge that RPS sites are situated on ancestral lands of the Dakota people. We acknowledge and honor the Dakota nations and the secret land of all Indigenous peoples. Present at this meeting are school board members and Superintendent Munoz, a non-voting ex officio member. Also present is Assistant School Board Clerk Michelle Severson. Ms. Severson, will you please call the roll?
Thank you. Clerk Amundson?
Here.
Director Barlow?
Here.
Director Garcia?
Here.
Director McLaughlin?
Here.
Chair Marvin?
Here.
Vice Chair Nathan?
Here.
And Treasurer Workman?
Here.
Thank you.
2.01, approval of the agenda. Are there any changes?
There are no changes.
All right, I move to add the agenda item 7.09, a closed session for preliminary considerations regarding allegations against an employee. We need to have someone move
Workman.
move approval and a
Yes.
second.
Second, Workman.
Thank you. We need a roll call vote. Ms. Severson?
Thank you. Clerk Amundson?
Aye.
Director Barlow?
Aye.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
And Treasurer Workman?
Aye.
Thank you.
Thank you. And now we need a motion to approve the amended agenda.
So moved.
I move.
McLaughlin.
Second, Workman.
Thank you.
Thank you. Clerk Amundson?
Aye.
Director Barlow?
Aye.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
And Treasurer Workman?
Aye.
Thank you.
The agenda is approved. 3.01, School Boards Association Awards. Minnesota School Board Association named Rochester Public Schools as one of the 2 recipients in the state to receive the District Award of Distinction, which is awarded to a district having a majority of board members who have received a Director's or President's Award. Kathy Nathan received a Leadership Development Certificate, which was awarded to members who have completed the School Board Workshop Series Phases 1 through 4. Vice Chair Nathan's current term expires December 2022. Mark Schlusner received a Director's Award, which is awarded to members who have attained 100 or more points of attendance at MSBA training programs within the past 4 years of their terms. Director Schlusner served on the Rochester School Board from 2017 to 2020. We have a lovely plaque. It is currently above school board mailboxes in the office. So I urge you to stop by and take a look.
Maybe you could
Another
take a,
announcement, Pardon?
could you take a picture of it and send it to us?
Oh, message from Ms. Amundson.
I would be happy to do that for you.
3.02, Cenergistic Environmental Excellence Award. Mr. Munoz.
Yes, this time I'm going to turn it over to John Carlson, Executive Director of Finance, and he will introduce our guests from Cenergistics. John.
Well, good evening, Chair Marvin, Superintendent Munoz, and other board members. I'm here with Doug from Cenergistic tonight, and Doug is going to present the district with an Environmental Excellence Award. So, Doug, hopefully you're there and you can turn your camera on and take it away.
Can you see me, John? Hopefully you can see me and hear me.
There we go.
Okay, good. Absolutely. As John mentioned, my name is Doug Bilyeu, Regional Vice President with Cenergistic. We partnered with the Rochester School District since 2018, and in this time of COVID, the work that you all are doing in this district is tremendous, and we wanted to celebrate the environmental impact that you've had on being able to be good stewards of your energy management and just being overall good stewards of your resources here within the district. So joining me now is Bob Herron, who's our client manager for the district with Cenergistic, as well as Adam Hansen, who's your energy specialist. When we take a look at the environmental impact of what you've been able to do with your energy reduction in 2 years, you've been able to drop your overall raw energy of electric and natural gas usage 16% since 2018. That's incredible. So when you look at that and the excellence that we're talking about here, that's 17,873, 924 miles driven by a typical car that you've been able to eliminate. 2,559 tons of greenhouse gas emissions that has been taken out, as well as the equivalent of 121,865 trees and the amount of carbon sequestered by those trees as they've grown for 10 years. So the job that you've done in just a short period of time is incredible from an environmental standpoint, and we wanted to make sure that we came out and shared that good news with your district. So I am going to present you with a certificate that you can put on display, but also another plaque that you can put on display as well with the Cenergistic Energy Excellence Award. And again, congratulations, because it's a lot of hard work from the administration, from the support from the board, from everyone within the school district to achieve this. And you should be commended for what you've been able to do. And we look to be even better as we move forward. So thank you so much for partnering with us. And we cherish the partnership that we have with Rochester Public Schools for sure.
Thank you so much, and this really is an important partnership. It's really gratifying to continue this important work. Moving on, 3.03, a COVID update. This is about our local situation and vaccine planning. Mr. Munoz.
Yes, we're fortunate again to have Graham Briggs, Director of Olmsted County Public Health, speak with us briefly. And then we are going to have Denise Moody, Joe Adino, and Jamie Smiley will talk a little bit about the mental health support that the district provides our students. So I'm going to turn it over to Graham first.
Thanks, Superintendent. I did bring a couple of slides for today. I know I've kind of limited amount of time tonight, but I want to try to cover as many topics as I can and answer as many questions as possible here with the time that I do have. So I thought I'd just run through at least some of the questions I know that the board has got around how we're looking at data and utilizing that as we're trying to really understand what's going on at the district level and beyond that out in the community as far as COVID transmission goes. So this is just a chart looking at the 7-day average incidence of cases in Olmsted County. So it's not a raw number. We're averaging about 40 or so cases a day coming in right now, which is down significantly from our peak in the middle of November. But for a rate, we can compare this now between counties or between states, and we can see that our rate now of cases on a rolling 7-day average is at about 26 or so cases per per 100,000 residents in our county. And that's just a little different way to say basically the same thing. I know that there's some questions about this a metric that MDE and MDH and we've been monitoring to help inform us about school decisions. And so that's looking at a 14-day incidence per 10,000 residents. So just a little bit different measure, but you can see the chart is basically telling us the same thing, that we saw a peak in the middle of November and we've been basically headed down since. There's just a couple intricacies here that vary between the way that you do it. For example, looking at 2 weeks at a time removes a little bit more of the up and down that we see with 7-day. Same thing if we go up another level to like a 3-day incidence, there's a lot more noise in the pattern that we're looking for. But we basically get the same results here looking at either one of these. The reason that this is important, and I think we want to be monitoring this over time, is because it tells us how, as long as we're testing, how much viral activity is out there in the community. And that, to me, as an epidemiologist and public health director, is an important piece in the equation here of how risk looks in the community when we're talking about schools and in-person versus distance learning. We have seen in districts around the country, if you're open and everybody's together, particularly if recommendations are being followed as far as distancing and mask use goes and things like that, schools, are just as at risk for anywhere else as far as COVID transmission goes. But as that number goes down, we know that the risk in the community is going down too. And so it makes, I think, me and others a little bit more comfortable that while the risk is not zero, as the risk decreases, the chance of a case coming into a school that is a staff member or transmission going on between staff and things like that maybe becomes a lesser risk as long as we've got some virus in the community. Now, I wanted to talk a little bit today, too, just about what we're actually seeing on the ground here in Olmsted County as far as our case data goes. So this is the next two charts here are kind of busy, so you got to pick through them a little bit. But this one is looking at age grouping. So you can see on the left, starting at 0 to 4, 5 to 9, 10 to 14, and looking at both the cumulative overall percentage of cases in each of those groups. So let's say, for example, we look at the 20 to 24-year-old age group, we can see that gray bar all the way to the right in that cluster is at about 11%. So that's telling us overall, during the entire pandemic, about 11% of our cases have been in the 20 to 24-year-old age group. Now, if we start going to the left, we can look back at the last week before this, the week before that, and we go back 4 weeks, compared to our cumulative number. So we can see in that 20 to 24-year-old group, last week we were seeing much fewer cases than we have cumulatively, so a decreased rate than what we're used to. The couple weeks before that, we were seeing about what we've seen throughout the pandemic, and then the week before that, again, a decreased rate. So I think for this conversation, I'd direct your attention over to those school age populations, up to that 19-year-old group, and we can see how that is also shifting over time. The 15 to 19-year-olds, for example, seeing that overall about 8% of our cases throughout the pandemic have been within that age group, but just last week it was about 12% of our cases. So I do want to couch this, though, with knowing that our numbers are going down fairly rapidly right now. The actual raw number of cases may not be going up, since this is a proportion, but the percentage of our cases that we're seeing in the community seem to be shifting towards some of these school age groups. Now, one thing that we've been working with all the school districts in Olmsted County over the months here is looking at trying to break this into elementary school and secondary education, and trying to help understand, since we've seen since the beginning that younger children seem to be much less at risk of transmitting virus in a school setting to other children or teachers. And so So that's something that we've been watching and talking a lot about is the difference between a 16 or 17-year-old and a 6 or 7-year-old in a school setting and the risk that poses to others. So we can see just looking back same way over the last few weeks here, that for the kids that are about between the ages of 5 and 11, and again, this is county-wide, so there are children in other districts that are in person. Rochester Public Schools has had started to bring in K through 2. We don't see much difference going on there, at least right now, as far as those 5 to 11-year-olds goes. And that kind of fits with what we're seeing at the state level and what we saw earlier in the pandemic as well, that there's not as much risk at least in those children at the elementary age. And when we go to high school, we see something a little bit different here, and we can see just in Olmsted County, since this is basically going back to the beginning of the year when we came back after the holidays, we can see how each week we're seeing a little bit higher percentage of cases in that 12 to 18-year-old group than we have cumulatively throughout the pandemic. And then that last bar chart here on the right is looking at overall kids 5 to 18. What does the percentage of our cases look like over each of these last 4 weeks? And we can see that increase there as well. This is what we call an epidemiological curve that many of you have probably seen just looking at our overall cases in the community. We publish this once a week on our website with overall cases. This is broken down just to school-age kids. So the blue bars are looking at on any given day how many school-age kids were diagnosed or confirmed with COVID. And that orange bar is looking at a 7-day rolling average. So from the day that you look at that line, you're going back a week and averaging the number of cases that we see. So what this really shows us is that it reflects transmission in the community. So we can see although a lesser spike, but a peak in activity in the middle of November that has generally gone back down since, but still is not back down to the baseline that we saw throughout the spring and summer. And you can see just a little bit, after reaching a low here, a little bit of increasing activity that looks fairly stable right now. But we still are seeing, we've had some days with over 15 cases in kids 5 to 18, just over these last few weeks here. So something to be aware of, and another indicator that the amount of transmission in the community spills into schools, and that doesn't necessarily mean that kids are transmitting, but we do see younger children that get exposed and may get sick. We see older adolescents that may be at higher risk for transmission, but more so with staff as well. The more activity that we're seeing out there in the community, the more likely we are to have somebody most likely accidentally walk into the school, as a staff member, carrying COVID and potentially expose others. And that's where we have seen some outbreaks with this up to this point. So I just wanted to give this group some numbers too, just so we know, what are we actually seeing here, beyond the studies and things like that here in Olmsted County. So I just looked at, so far since we came back to school in 2021, and asked our epidemiologists to take a look at these numbers and split them out for us. So we have seen an increase in school-age kids over the past few weeks here in Olmsted County. As you saw in the charts, it's older students that appear to be the driver in this increase here locally in Olmsted County. And this is consistent with what we're seeing in Minnesota overall, and generally what we've seen throughout the pandemic is older kids potentially at a little bit higher risk of transmitting. School activities, and in particular high school sports, have contributed to this increase. So far, just in 2021, we've had 6 different athletic teams that have seen transmission, not a case, but transmission associated with that team or sports activity. And that's over just the last 4 weeks or so. So that is something that we saw last fall, and that we've seen throughout, particularly in high school settings, or that sports that are difficult with social distancing potentially pose a risk for transmission amongst those team members. And then in addition, potentially that virus can get into the household from there. That's where we start getting a little bit concerned that higher risk individuals could potentially be exposed, or in rare situations that younger cases can have severe disease as well. So far this year, we've been watching this, for a number of months now. But generally, what we've seen is student-to-student transmission. So on high school teams, we haven't seen a lot of, at least so far this year, transmission to coaches from student athletes. But we have seen athletes transmit virus back and forth. The thing that I think we've talked in this group a little bit about in the past, and a concern that I have, is teacher-to-teacher transmission. And so I think the CDC over the last week or so, or a few days here, has been talking a lot about getting back into school safely. And from my vantage point, I agree with that in theory, but with two caveats attached to it. If you've got a high level of transmission in the community, it becomes much more difficult to do this. And then on top of that, we can, or you as a district can provide face shields, you can provide protection, you can tell kids to sit 6 feet apart, but breaks in protocol can and likely will happen from time to time, and that's whether it's in schools or hospitals or other workplaces. Once you bring people together, there's that chance that people put their guard down when they have lunch together, or decide that they're going to go to happy hour together after work. And so just bringing people together, there is that chance that once there's a breach in protocol, that you can see transmission, and we've seen that previously as part of this pandemic. So kind of a complicated topic, I think, with the CDC recommendations coming down, but I wanted to give you my 2 cents, at least what I see on the ground as far as risk goes. Just in 2021 so far, so you've got a number here looking county-wide, and this number changes quite a bit as we're trying to rule things in or out, or count cases, or figure out where they live. We do, at the county level, we've got 36 COVID cases that have reported that they work in a K through 12 setting, and since the beginning of the pandemic, we've counted 181 individuals that have told us during interview that they do work in a K through 12 setting. A fairly high percentage of those people, I think so far in 2021, when I look at the numbers, it's about half of them may have been at work while they were potentially infectious. And so that doesn't tell us specifically teachers are passing it back and forth, or bus drivers are, but that does tell us we've got people out there in the community while we've seen activity happening, and at the same time we are seeing some risk there where people that don't know that they're infectious or haven't gotten sick yet have been in work settings, and without good precautions in place could potentially pose a risk to others. We'll provide just one example that this group is probably familiar with Bloomington. Opened back up in person. That lasted 2 weeks until they ended up with an outbreak in their bus drivers, and they don't have enough people to drive buses, so they had to go back to distance learning. And I know that there's been some concern in this group about that yo-yo sort of situation where you send kids back, then you got to pull them home, then you send them back, and that becomes a real challenge, I think, for parents in the community too, going back and forth, and for the kids actually too. I wanted to talk about vaccine a little bit. I know a lot of what I and the health department are talking about right now in the community is related to vaccine. So we can see in Minnesota overall, it's about 8% of the population has had a dose of vaccine. So just under 500,000 people. Here in Olmsted County, we're at about 18.4% of our population has had a dose of vaccine. We're at a higher percentage, but we've also got a higher percentage of healthcare workers, obviously, in this community. So we are just over 20% now of people over 50 years old have also had a dose of vaccine. So we're not there, but we're moving quickly as vaccine arrives to get shots in arms. This is a graphic that I took off of our website. We're trying to update this as often as possible since recommendations are changing routinely. I know there's some questions about when school staff will have access to vaccine, and so we're on the verge of wrapping up that last third priority group of the 1A population. We've seen the governor start to do a very small number of, making small numbers of doses available for education, child care, and individuals over 65 through some pilot sites. And some counties now, including some around us, have started moving into this 1B population. So I think we're very close to that here, but it's a very large population looking at essential workers that need to be at work and potentially have exposure to the public as part of that job. So teachers and school staff are part of that group. My guess is here we're going to see vaccination and availability of it for education professionals going up, but probably not to the point that we'd have everybody done in the next week or two or anything like that. It's going to be an effort to get through it. But I think we're going to go from a couple hundred people being vaccinated to many hundreds of people here, hopefully over the next month or so, and we'll see how vaccine supply goes from there. That's all the slides that I've got. I'm not sure if we want to take some time to go over questions or what's next for the board here.
Yeah. Oh, we do have time for a few questions.
I'm trying to unshare there. So hopefully you can see me now again.
Ms. Nathan has a question.
Hello, Mr. Briggs. Welcome back.
Good to be back.
At our last meeting, the superintendent talked about a metric of that 14-day rate per 10,000 being under 50 as a metric for us to make a decision about going back in secondary. And we've had a lot of questions from the community about what the difference is between an under 50 and an under 40 and an under 30, because those are the criteria from the original Safe Learning Plan. And that a lot of the other districts that are going back or considering going back have rates that are maybe in the low 40s or in the high 30s. So can you give us a little bit more clarity on how important that 50 number is, if it's the right number and what we should be considering as a metric?
Yeah, I think when we were looking at that 14-day curve, there isn't, in my opinion, there's not a specific right number. I believe it was either MDE or the governor, somebody from the district might need to give me an assist on this, but the 50 was set as a number to so that we had a number there to say over this we feel pretty uncomfortable knowing that there's a lot of virus out in the community, and under this we're starting to see that that risk of a staff member bringing COVID into the work environment is getting to a point that that risk is manageable, basically. So 50, it's a little bit difficult to put into words, I guess, but 50 isn't a be-all, end-all, but I think it's a good place to start the conversation. That now that just over the last couple of weeks here, we have seen our numbers going down, all the way back to mid-November, but they've been going down, slowly. We have moved under 50, and so in my impression, that says, okay, so now we should be talking about, what can we do? How can we make sure staff are protected? How can we get kids on buses safely? And how, is this sort of stuff possible? I wouldn't say it means you snap your fingers and everybody goes back tomorrow necessarily. There's still virus out in the community, more so now than there was, in September or even last spring. So it's a point to start the conversation at, in my opinion. Jean, I think you're muted.
I am. Other questions? Ms. McLaughlin. Karen, do you have a question?
I turned myself off instead of on.
Okay.
Sorry, Mr. Briggs, thank you for being back with us. We've been hearing from constituents and other media sources, that kind of thing, about these more virulent strains. Can you talk a little bit about that and what you anticipate could happen here in Olmsted County if that hits here?
I think that is something that we're watching very closely. I know Minnesota has been doing surveillance through sequencing, looking for variant types here in this state compared to other states. And I know we were the first state to identify the Brazilian strain here. So we know we've got both the UK strain and the Brazilian strains in the metro area. It's possible in the coming months that the UK strain in particular, could become a dominant strain. That's not unexpected. Viruses evolve. This is how this stuff works. But it is another variable to think about. A higher transmissibility, but not more highly fatal case by case. There's pros and cons there. That's nice to see that we don't see a higher percentage of the people getting this dying. But if we see a lot more transmission, that's the biggest challenge that I think we've seen in public health and in clinical medicine throughout the pandemic is once you run out of oxygen tanks and ambulances and things like that, things grind to a halt as far as medical capacity goes and our ability to keep people healthy. And so that's something that we're keeping an eye on. And our hopeful path out is to out-vaccinate the virus before it mutates and becomes better adapted at passing through humans.
And just a quick follow-up to that, I've heard that one of the concerns is like a 6 to 14 week time period. Is that what you're looking at as well?
Yeah, I think it's variable. I've heard some other public health officials talk about in this coming 4 to 6 weeks and then a couple of months after that. It really is variable on how available the vaccine is, how if there's competition between different viral variants. We're just looking here locally. We're a little bit of an outlier, but seeing that 20%ish of our population's vaccinated, another somewhere around 10+% have likely been infected and have some sort of immunity. We're not to the point that we've got herd immunity, but we are potentially to the point that we could be starting to interrupt some transmission now. And so we may put a little bit of a wall around ourselves as a community if we can get the community protected. If we do see more transmission of these variants down the pipeline here.
Ms. Amundsen.
So one of the challenges, of course, for both us and you and the people you work with is the lag in data. By the time we get these numbers, per 10,000 numbers, they're several weeks old. And presumably by that time, if we have more transmissible variants coming, it means more of a potential spike. Could you talk to me a little bit about how your department, me and everybody who's listening, how your department would handle any red flags that you see happening in our community and communicate them and work with the school district before we wait for the 2 to 3 week delay in those numbers, giving us those per 10,000 levels, just to reassure people that that we have the ability to react quickly should we perceive something urgent.
Right. I think the numbers that are available through MDH and that published 14-day number inherently is going to have data lag in it as it's going up to the state. The numbers are being generated. It's coming back down. The number that I showed you tonight on that 14-day curve is up to yesterday's data. And so that's something that I think is extremely important that we've been working on alongside all of our school districts here, is that 2-week or month-old data isn't going to cut it. We are looking at our data every day and making sure that our epidemiologists are doing analysis on it, looking for things like, do we see a spike in 10 to 14-year-olds? And when we have seen those sorts of things, that tells our basically disease detectives to go dig into that and see, at times where it was a spike between 40 to 50-year-olds, to go really drill into that population and see what risk factors changing, what's going on in the community. And so we do that all in real time as it's coming in, as we see these changes compared to the cumulative or the expected number that we would, that we see. And so that's the same with the students. Some of those first charts that I showed you are literally what we use to look at change week to week over time compared to cumulative, and we look for those spikes, and can even generate systems that will detect those for us, as we're breaking down all these numbers, so that we can pay close attention to those changes, identify them in real time, and then make adjustments with strategy so that we push those spikes back down as they pop up.
So in essence, those state level data is not where you would direct people to follow if parents are curious how we're doing. It would be the local data. And just to reconfirm, anytime your department would see some sort of a number that they had concern, you wouldn't wait for the next report to come out. You are constantly working with the school district, and if you see something of concern, you'd be right on the phone and communicate.
Yeah, we've actually got a schools team that is working every day, working with school districts, helping to assist on contact tracing, or go look at changing guidance, and be available as necessary for the districts. The districts, I will say, across the board, gotten very, very good at working on cases and understanding risk and responding to these situations as they come up. And RPS in particular has some great staff that really have become COVID experts, I think, alongside us at the health department here over the last year or so. But it's not just about schools, though, the things that we work on, whether it's restaurant exposures or workplaces. We're doing that sort of analysis just on our cases overall. And so that school age population is just one of those pieces that we're looking at. And as we see all these different things changing in this calculus equation, we're looking at that and figuring out that it's an apartment complex, or students at a certain school, or a certain occupation, or whatever is the risk factor that we need to figure out what's happening, get in front of it, and remove that risk factor so we can stop transmission.
That's great. I just want to make sure people are reassured that, there's a lot of people out there being very careful and methodical about being on top of this.
Ms. Nathan, you had another question.
Yes. Mr. Briggs, I heard you talk earlier about the CDC observation about going back to schools and the mitigation factors, and making sure that those mitigation factors are in place. Right now, we have the hybrid model for elementary, where we do have the 50% in the buildings, and we do have social distancing, and we do have 50% on buses, and we're wearing masks, and the face shields are optional. Given the current rate of transmission in the community, would you say we're at a point that we could take away some of those mitigation factors, especially the social distancing and the 50% in schools, and still consider it safe to go back to school?
Well, I think there's good evidence in elementary school settings that with proper precautions, if you're following the CDC recommendations, that you can do that safely. And I did refer you to our schools team for the specifics on those recommendations to make sure we do that right. But as long as we're following that with a low amount of transmission in the community, where we are, not to say it's a solid number, but we're under 50, and that conversation makes sense now, that that there's some good evidence we can do this safely, as long as we're keeping staff in a situation so that we're not accidentally oh, we're following all the rules in class, forgetting that when they go out to lunch, the rules go away and they potentially expose each other or something like that. And that's the key, I think, is ensuring that we can keep staff safe as they come back in an elementary setting. Secondary is a different story, knowing that the students are a risk to pass to each other and to staff. And so we've got to be a little bit more careful in that environment. I think based on the experience that we've had as a country and including here locally, that when we put high school kids together, we've seen transmission almost immediately every time we've done it.
Thank you. We've got time for a couple more questions. Ms. Workman.
Yes. Once again, Mr. Briggs, thank you for Mr. Graham, thank you for being here this evening again. I really appreciate the fact that you're willing to take so much time with us. When you were showing the rates of transmission or the numbers for the school age group, I also noticed that farther down on that chart, there were the adults. And those numbers, from my glancing at the chart, look to be considerably higher. We have 2,800 employees roughly in the public schools. Even though there's a lower risk among our elementary students, more of a risk among our secondary students, particularly high school, where does that leave the adults in this? And can they expect to be more or less protected in this environment if they're in a hybrid situation or fully, in school full time?
I think time is one of those variables that we look at. So just going outside of your house and going to a place where there's other people indoors, there's risk. There's, in the middle of a pandemic, there's inherently risk. Excuse me. So you immediately move to non-zero as soon as you go into Target or you go out into public. And so that's the question I think that we're looking at right now for staff being in person. In a hybrid model, there's some risk. However, over this last year, I think we've learned a lot about this virus, so we get more comfortable then saying we can minimize that risk by 50% kids, limiting how kids are riding the bus, limiting the number of days that the kids are in school and the distance between the days that they're in school, and making sure that we're providing protective equipment for staff. All of that sort of stuff can really push that risk down very low, but we know that risk is there. Just since January, if I remember the number, I think we've had 36 people that I can't say for sure that they were exposed in schools, but we've had 36 people that work in schools that have gotten sick one way or another. And my guess is, for the millions of people around the country, some people just aren't paying attention. I know from our interviews, from talking to the staff that are doing the interviews, we've got people that are following every recommendation down to the T, doing the best they can. And they had a friend over for lunch, and that was it. And they got COVID and ended up in the hospital over it. And so there's always going to be that risk until we get the population vaccinated. It's just a matter of what risk is acceptable, or what risk are people willing to absorb to put kids into an environment that's more conducive for teaching.
Thank you, Mr. Briggs. And I think that's the million-dollar question right there. What's our tolerance level? Okay, one more question, Dr. Garcia, and then I think we're going to have to let Mr. Briggs go. Not forever, just for now.
Yes, thank you. So you were mentioning risk, but obviously risk is not even across the board for our communities. So our BIPOC communities are obviously harder and more critically affected by COVID than our other populations. And I'm wondering if you in your office offer any targeted resources, and how might we as a district better connect and promote those resources. And I'm also thinking particularly those that are in languages other than English.
Right. I think it doesn't get as much attention as cases in contact tracing and vaccine, but basically the entire pandemic, we've had an education and outreach team that has been doing Facebook Live events with the Somali community, or working with Rochester Healthy Community Partnership and IMAA to work with community leaders that have a voice in communities that speak languages other than English. And what we've been trying to do now recently is move away really from education about what COVID is to education about vaccine and access to vaccine, and start talking about equity and how people can get access to vaccine as it becomes available, so that when we have those doses in our hand, we know how we can get to the communities that may have more difficulty accessing vaccine. And so that's something that I think we're working with the school district on. I'd love to see it continue to grow with communities of color and with other communities that are going to have more difficulty accessing vaccines. So beyond, town halls are another thing. Just over the last 2 weeks, I know we did a town hall with Black and African American Pastors Association, with a Cambodian group, Ethiopian group. There's one I'm forgetting off the top of my head, but these are all parts of working with the community to make vaccine and access to health, including mental health and school and all of that, as easily accessible as possible.
Thank you so much, Mr. Briggs. And speaking of mental health, Mr. Munoz, I think you have Denise Moody standing by.
Yes, I have Denise Moody, Director of Student Services, and then we have a school counselor and social worker. I'll turn it over to Denise.
Good evening, board members. Thank you for the chance to be here. I am here to talk a little bit about the services that we're providing to address the mental health and emotional well-being of our students. I know that it's a concern that has been across our community, and I wanted to be able to provide some information about what we're doing to support families and some of the things that we are collaborating on with our community agencies. So I have two members of our emotional and mental well-being team here with me today. Jamie Smiley is a school social worker at John Marshall, and Joseph Andino is a school counselor at Riverside. And so they are going to just take a few minutes and share a little bit about what their workload and kind of supports to families and students have looked like over this year, and some of the needs that they're seeing. And then I'm going to just finish off sharing a few details about some of the collaboration that we're doing with communities, mental health agencies, and community providers to partner to address the needs of mental health needs in our community. So Jamie and Joe, I'll have Joe start if you just want to introduce yourself and share a little bit about your work over at Riverside.
Hello, everyone. My name is Joe Andino. School counselor over at Riverside. So to start off, as far as individual kind of services, one-on-ones, things as a school counselor, those are down, but teacher and parent contacts are much higher. I'm consulting a lot more with teachers and with parents to see what we can do to help. It's been difficult to connect with the kids over Google Meets, and so we've been working together as kind of a team approach. I've seen mental health issues for my students at home and at school. Students are in a dire need of personal connection. I've got a couple of students who are they haven't quite figured out they can't hug yet, so they're hugging with their arms straight out, but still kind of running up to you. So it's not really a hug, but they're trying to. And I've also got some students who are sticking their elbows out to do elbow bumps, and they're doing that to every single person they can find. So it's shown. Students are also feeling pretty anxious about being at school and being at risk. I've heard they're afraid about getting other people sick, and kids have had some trouble recognizing their teachers, which on one hand is kind of adorable, but on the other hand is concerning. It's causing additional fear for my students. Kids are doing, as far as how they've been reacting, how they've been feeling, doing better with the smaller class sizes. We've had fewer behavioral issues, the earlier dismissal time has helped a lot. Kids don't get as tired. They're not as frustrated. They're feeling better. With that. To be clear, mental health was an issue before the pandemic. It's an issue now, and it will continue to be one afterwards. We need unique supports, no matter the educational model. No educational model will solve all of our students' mental health problems. We need the support of our entire diverse community. If we were to get the help our kids need. But I do want to say, elementary school counselors, I know that we are dedicated to helping all of our students and want the best for each of them. So we will continue to work as hard as we can to help all our students. And thank you.
Thank you for sharing, Joe. I think we'll have Jamie share, and then maybe the board can ask any questions when we're done. Jamie Smiley is a school social worker at John Marshall High School, and she's going to share a little bit about her work at that level.
Hi, thanks for having us. I just really wanted to share as a high school social worker, things obviously look different. A year ago, and being able to reflect, our students were able to stop by our counseling office if they were in crisis or if they really needed something from some of the support staff, and that's vastly different. And as Joe said, mental health issues, we saw it before, we continue to see it, and part of it is how we're going to provide that support to our teens and our families, because I think we can't just focus on our teens, but really have to consider the whole family. Some of the things that we've done in our building, obviously the virtual appointments individually, meeting with parents, students, being able to connect with a variety of service providers. Some of the benefits that I think we've seen is some of our families who really aren't able to travel as much, that has been a benefit, where if we are going to have a meeting, they really don't need to coordinate getting off of work necessarily. They can join during a lunch if that works for them. With teens, I really didn't have contact with students via Google Hangouts or even by email, and I rarely had a phone call from a student. As you can imagine, that's very different now, because they are utilizing that technology more, and even from the messaging piece and meeting teens where they're at and the culture that they are a part of, really offering a variety of ways that they can connect with mental health professionals. One size does not fit all. There are still students who lack access, do not have cell phones, do not have ways to connect with a mental health professional at school using tech. But something that I do feel that JM has done well is being able to offer some of those in-person support. So I've met with some students in the building. I've met with parents as well. And if they are lacking transportation or because of their schedules, it's not going to work. We have done quite a few porch visits where we just want to know if the student's doing okay, what supports do you need? Instead of sending them an email, maybe we're printing materials. That's something that I think we've really felt to be beneficial during this time, is being able just to print some information, leave it with the family, they can think about it. And that includes some of the contact information. Who is at your building? Who can you call when you have questions? If you're concerned about your student, concerned about your family, and specifically the resources they might need. I think the life stressors for our teens have looked different, as well as very similar to in the past. They've picked up extra jobs. They've provided some childcare to their families. And I think that's really complex. I think we can't just look at mental health from one angle. I think it's a very complex situation where, they're dealing with food insecurities, transportation, finances. And I think we really have had to talk with teens and families individually, because like I said, it really one size doesn't fit all. If students were in the building, we would still see some of these concerns. And I think that if a family or a student are wanting information, that they should call their school and see. I think there's a lot of support staff, school counselors, school social workers, resiliency specialists in their buildings that can really try to help them figure this out, because we don't have all the answers, but we're definitely willing to partner with them and see what they might need. And I just think that's really important. I think we've pulled together even more as a team. At John Marshall, we started meeting as an official outreach team, even as of last year, and through that, we've had hundreds of referrals of related to students, and maybe it's concerned about academics, maybe it's concerned about attendance, it could be their wellness, it could be that classroom staff just really don't know what else to do. And so we really collaborated together in order to kind of problem solve what they might need and see if we can provide access and just figure out what might be best for them to be successful in and out of the school. And then the other piece with the porch visits, we've had a lot of staff, go to apartments or homes and meet with people outside their home just to see what they might need as well. Thank you.
Thank you.
Thank you. Denise, if we have some questions from board members, is this a good time for them to ask?
Yes, it would be.
Okay. Any questions? Ms. Nathan.
Hi, and thank you for being here tonight, and thank you for all the ways that you are individualizing your services to the individual needs of the students. We've heard a lot from parents who have shared stories about how their students are struggling. And we haven't heard much from them about the services that they're using or how they're taking advantage of the services that you all are offering. So I'm wondering what we can do to encourage someone who may not think these services are for them, or who may not think, this is what their students need. How can we get them over that barrier to reach out and take advantage of what you all are offering? That it's not one size fits all, but there may be something for everyone.
I think that's one theme that as we've been developing kind of our outreach and our supports is that people find the support when they are ready to be there. And so one of our approaches has been, how do we lower that barrier to being able to find that support? So I know you're aware we've been offering free consultations. So if the insurance is the barrier, if the scheduling is the barrier, how can we help remove some of those barriers that they have for that initial contact? Because sometimes there's a lot of stigma around mental health, and there is a lot of different reasons why families might not connect or students might not connect. So I guess in response to your question, Kathy, I think it's about making the resources available. And then I think encouraging them to make that connection with their emotional and mental well-being team members at the school. So that's we've been trying to really create that connection and create ways to be able to know who they are and have that relationship with them that isn't in a way that requires you to make an appointment or make a therapy appointment. That sometimes it's just you need somebody to brainstorm with or kind of know what those next steps are. So I think we continue to put those messages out. We continue to try to find ways that will reduce some of those barriers for families.
Thank you. Mr. Barlow.
Yes, thank you. Some of what I may be waiting to hear may come from Denise later. But Joe, you'd mentioned that in terms of where some students may be, that they had needs prior to, and that they will probably continue to have needs. And so I guess I'm thinking the truth is, though, a lot of the contacts that we're receiving aren't necessarily, I'll say, are probably from general population students and families who maybe weren't necessarily on your radar. And what you're currently doing, I don't want to seem redundant in the question I'm asking, but I have done some research that would suggest that there are behaviors that are from attempted self-harm to increase of drug, alcohol, to a number of things. And I guess, can you or the team offer information as to how are you seeing in our district an increase? I know I asked this at our last board meeting. Are you seeing an increase or not? And how would you gauge the overall effectiveness and what we're able to do? And then before you comment, what this pandemic has done for me is made me more aware of all the professional organizations that are out there and research papers that are available, some of which our community freely sends to us as reference material. But this particular one, and it was probably 6 o'clock this morning, I just had a thought regarding, well, I know there has to be some psychological modeling which is in existence. So I visited the American Psychological Association website, and they had a guide to schooling and distance learning during COVID-19. And I guess, are there specific strategies that the team has adopted because of COVID-19, or are you simply continuing the model that existed prior to and maybe tweaked it a bit?
Specifically regards to mental health services, Director Barlow, or are you thinking more broadly around education?
Well, they go hand in hand, don't they? So I guess I'm not necessarily differentiating between because, but if you see them as being distinctly different, that's fine, and so I can be educated as I listen to what you have to say.
Okay, Joe and Jamie, if you'd be willing to just address maybe the question about how you've changed your services or changed your service delivery model since we've been doing distance learning and hybrid.
No, thank you for the question. That's a great question. It's good to know how we have adapted. So we've adapted in a couple of specific ways. First, we are communicating a lot more with teachers and parents because we are having Google Meets at home. We are able to communicate more directly with parents and talk about implementing plans or implementing how do we help our student at home. For example, if they're having an issue getting on to Google Meets or they are having apprehension about joining a Google Meet, we can talk about that directly with the parents. So that's been very beneficial. Many of our counselors throughout the district have had open hours. One of the benefits of being a school counselor is kids pop in and they ask you just all sorts of questions, whatever they need. And in a distance learning, that's hard to get. So we've had open hours where Google Meet is set up. I'm sitting there and I'm working away, but virtually I get a knock on the door and I can talk to a kid about whatever's going on. Sometimes it's just, I've got a younger one and they just want to tell me about this new toy that they got and they have anyone else in the house that they can tell about right now. So they just tell me about that. But we also have students with more complex needs where they're having a really tough day and they do really want to talk to someone. So having those times available, we've made those adaptations. And then same with stopping in, one of the benefits of school counselors, we usually, pre-COVID, would stop into classrooms and participate, let the kids know we're there. I do that now, but I do it virtually. We stop in and say hi to all sorts of class meets. We participate. Sometimes we play a game or whatever the teacher's doing to kind of bring her students in, and we make sure that we're visible and accessible to all our students.
Thank you. Dr. Garcia.
Thank you. Sorry, I think they kind of answered some of my questions. I think one of the more pointed questions I was going to ask was about caseload. I know you typically carry X number of students on your caseload, and I'm feeling if it's like a 200, 300 students and you were only seeing like 10 of them to begin with, and now you're seeing almost all 200 or 300, I was hoping you could maybe speak a little bit more to if not specific numbers, maybe some percentages of how much your direct contact has actually increased. And I'm also wondering, I'm not necessarily sure that you are all providing this, obviously, because you are other staff and educators as well, but I'm wondering if maybe Denise, you could speak to, other than like EAP, what's being done for staff and educators who are struggling. And I would like to include you guys in that, because obviously not only are you also going through the pandemic, but you are also taking care of everyone else's mental health who's going through a pandemic. And so as a psychologist, I feel you on that. And I want to make sure that you guys are also being taken care of, and what other supports you feel like you would need if you feel like something would be easily accessible that, you know, we would help offer so that you could increase services also to students. So I know that was a lot, and feel free to respond however you need to. Maybe I'll address the second part of the question, and then Jamie and Joe can comment on their caseloads. If you read educational literature or blogs or podcasts right now, this is a common theme right now about how do we support the adults in our system as well. I think that it's a need across our country, and a growing realization of the demands that being in a helping profession, especially during a pandemic, has on the staff that are doing the work. And I wouldn't say that we have it completely figured out, but we have some things that we're trying. So I know that a lot of our schools are doing some book studies around different books. So there's a book called Onward Regular, and I know that we have some groups that are studying that book. We have somebody that's doing some mindfulness work with this was something we were trying to address actually pre-pandemic. So we had a relationship with the Mayo Clinic Healthy Living Center about them doing some sessions. So they are also they're doing a session for our paraprofessionals on the 15th, and they're doing a 6-session series. We've also, we had a meeting today talking about, how do we support our staff during this time, and thinking about how do we host just supportive conversations. How do we create space and hold space for educators as they are processing all of these different emotions? And it's hard, that there is isolation that comes with some of the restrictions around this pandemic, and how do we have to be more intentional about helping people create those connections and be in community with each other. So that's one thing that we're looking at doing in some of our staff meetings across some of our leadership groups, is being able to be just intentional about creating space to talk about how this is impacting us emotionally and personally as well. So we are actively working towards that. I don't think we've gotten there exactly. I think that this is hard. That is kind of the strategies that we're trying so far. Joe and Jamie,
Thank you.
Do you want to comment on Dr. Garcia's first part of her question around caseload? Is that okay, Director Martin?
Yes.
I think that the caseload piece for high school social workers and really some of the support staff that we have, I think it's a constant fluctuation. So that is something that is hard to really put into context. And when you think of caseload versus workload, there may be a student or family who are needing more support on a weekly basis, and other families and students who maybe are needing something on a bi-monthly basis. And when I look at my list of a caseload, because I think you're looking maybe for more of a number, it really does fluctuate between the 140 to 150 that have more of that consistent reaching out, or on a frequent basis, maybe connecting multiple times a week. So hopefully that helps to answer your question.
On the elementary end, I'll speak on that. It has been a drop in one-on-one sessions. I would say a pretty large percentage. Let's say maybe around 50%. But and behaviors. when we talk elementary, I think behaviors are a big part of mental health because children are acting upon how they're feeling. So when we see a drop in behaviors, we understand that they're not acting out right then. But I think a lot of that has also been our smaller class sizes. That has been incredibly beneficial. We don't have arguments about whose is, I need to take that, or we're not fighting about sharing, or we're not arguing about you being too close to me or you bothering me, because we have so much less students and they're spread apart. But we've also seen a large increase in teacher and parent contacts. I'm talking to teachers almost all the time, just all the time, emailing, helping them make a plan, helping them decide what to do. It's been tough for a lot of our younger kids on Google Meets, so that has been a part of our drop as well. I have students who do not want to be on Google Meets, and that's their main fear, is a Google Meet. And if the only way I can contact them is a Google Meet, that makes it difficult. So we've had a bit of both in the situation.
Thank you. Okay, and Miss Nathan, you have the last question.
Well,
So it better be good.
Denise is going to know. I think Denise is going to know what my last question is, because I always like to give you the opportunity to share your resources that are out there on social media, and especially the 2 upcoming events for parents at the high school and the middle school level. So I'll let you do that.
Yes. So one of the offerings that we are providing this year is monthly family sessions that are hosted at the building level. So we have a session at both the high school and middle school level that Ashley Bauer, one of our mental health practitioners, is going to be presenting on kind of look-fors, or like when to get more support if you're concerned about the mental health of your child. So we're doing, the elementaries are also hosting some, but yes, we posted today about the middle school and high school events. And so in addition to that, I mentioned it earlier, but we are also able to offer, in collaboration with some of our community providers, with Fernbrook Family Center and Summer Valley Mental Health Center, is a free consultation with a therapist. So no insurance, no paperwork, schedule a time on the online scheduler, and just have a chance, if you want a chance to kind of just consult or talk about a specific issue with your child, that's a free resource that we've been able to make available through some collaboration with our community providers.
Denise, Jamie, and Joseph, thank you so much for sharing your expertise. I know this isn't the last time we're going to hear from you. You do such a great job taking care of the students and families in the community, and we always get smarter after listening to you. So thank you so much for your time.
Thank you for having us.
We'll get back to our agenda now. 4.0, this is the consent agenda. Are there any items to be removed for a separate consideration? Hearing none.
Move approval,
I'm
Nathan.
listening.
Second, McLaughlin.
Okay, it's been moved and seconded to approve the consent agenda. Ms. Severson.
Thank you. Clerk Amundson?
Aye.
Director Barlow?
Aye.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
And Treasurer Workman?
Aye.
Thank you.
5.01, research request for a pilot study of...
Chair Marvin?
Oh, Mr. Munoz, I will
Excuse
get
me.
this right eventually.
Okay, yeah.
Retirements.
Yes. First teacher retirements, we have Janet Carlson, first grade teacher, Bamber Valley, been with the district 36 years. Judith Huddleston, kindergarten teacher, Elton Hills, been with the district 22 years. Darren Schmidt, PE teacher, district-wide, been with the district 26 years. Paraprofessionals, we have Maria Carride, special education para at Hoover Early Learning School, been with the district 9 years. And then student nutrition services, Charlene Bursek at Bamber Valley, been with the district 2 years. And also, I should have said this a little earlier when we had our two presenters, but we are celebrating School Counselors Week this week. So want to thank all of our school counselors and other mental health providers that, you heard about some of the supports that they're providing, but they're being very creative and working extremely hard to address the mental health needs of our students and, as you heard, helping our families as well. So let's thank them for their service to our district as well.
Absolutely. Thank you so much. Then moving on, 5.01 research request pilot study of HappiGenius social emotional learning curriculum at Gage Elementary. Mr. Munoz.
Yes, I'm going to turn this over to Brenda Witchman, Executive Director of Curriculum and Instruction, and she'll introduce our guest tonight. Brenda?
Yes, this topic is very timely given the conversation of the past half hour or so. With us tonight is Dr. Chris Parrott from Mayo Clinic, and he has some other people with him as well, and they want to pitch their proposal for doing some great research at Gage Elementary. Dr. Parrott.
First, I'd like to say thank you, Brenda, and to the rest of the cabinet, and of course to the board for taking time in what I know is a very busy schedule to consider this request. Inside Out has, by all measures, had an extraordinary relationship with RPS for 13 years now. This work has included lots of science, but also projects in well-being for students and teachers. And as we move to include social emotional well-being into the science that we're sharing with RPS classrooms, our partnership with Gage Elementary revealed some potential opportunities in identifying and providing support for students in that SEL space. In parallel, we began providing access to Dr. Amit Sood's Resilient Option program for all teachers trained in our summer workshops. Dr. Sood's team also collaborated with RPS through testing and offering resilience programs to teachers and staff in parallel. Adult participant data from these experiences showed significant growth in mental health literacy, resilience, happiness, and a reduction of measurable stress. These data were further confirmed and supported in our summer undergraduate programming, where we saw similar significant improvements in 170 participants in a distance workshop. Today, we have shared with you a plan to move a new K-5 offering from Dr. Sood into the context of our classroom relationship, first with Gage for pilot evaluation. Specifically, the third grade team will help us evaluate the potential advantages of including Dr. Sood's HappiGenius program at their school in partnership with Will Ruffin and the Community Center. HappiGenius has been offered online in 3 small pilots and is currently being piloted in person at Longfellow Elementary and another school in South Dakota. The experimental design has a parallel use of non-SEL inside-out curriculum as an engaging control. And the advantage to students is the very likely parallel positive growth and well-being that we've previously documented in adults. The effort and our measurements are focused on training both self-compassion and self-regulation. Further, the Gage team is helping us to revise and improve this program to meet the needs of each and every student participant, including growth toward a Spanish language version. Further, we are also trying to support the teaching team through the Resilient Option program for them and several of their family members right now. We will also be providing similar services to interested adults and family members through the Community Center at Gage. Dr. Sood and his daughter Gauri, co-developers of HappiGenius, Kit Kinnear, a Mayo Clinic graduate student and the lead of the scientific effort that we're discussing here, are with me to answer any of your questions. And again, I'd like just to say thank you for giving us this time and consideration tonight. We'll take any questions.
Any questions, board members? Dr. Garcia.
Yes, I'm sorry. It is just a logistical one because I looked through the proposal and all the information. It looks great. What about the consent and assent letters being provided in other languages? Because I only see the English version there.
That's a very good question. Kit, have we addressed that at this point, or is that something that we need to address going forward?
Yes, that is something we would need to address. Thank you so much for asking the question.
At this point, that is something that we've traditionally turned over to Rochester Public Schools because it actually goes out through their mailer. But that is definitely something that we will look into and ensure that it's addressed in time for our IRB discussion on this Thursday.
Sure, thank you. I just didn't know if it was only in English for our benefit or if there just wasn't one in existence. So as long as they have other languages, that's perfect. Thank you.
Absolutely.
Ms. Nathan.
Well, good evening. I have nothing but good things to say, but I just want to divulge for the record that I will be abstaining from the vote as I am on the board of directors of the Inside Out Foundation. So thank you for being here tonight and for bringing this opportunity to our students.
Absolutely. Thank you very much.
Other questions? It seems to me that this is a very well prepared proposal, and research is going to be exciting. The project sounds great. It's currently a briefing item, which is a hint to the board that in the event I see Ms. Workman's hand up. Ms. Workman?
I would like to move this to action.
Second,
Did you hear
Garcia.
that this time?
It's been moved and seconded to move this to action. All those in favor will tell Ms. Severson they're in favor when she says your name.
Thank you. Clerk Amundson.
Aye.
Director Barlow.
Aye.
Director Garcia.
Aye.
Director McLaughlin.
Aye.
Chair Marvin.
Aye.
Vice Chair Nathan's abstention noted. Treasurer Workman.
Aye.
Thank you.
This is an action item. I'll read the resolution. Be it resolved that the School Board of Independent School District 535 approves the pilot research study HappiGenius Social Emotional Learning Curriculum at Gage Elementary.
You have our sincerest thanks for your continued partnership. Thank you much.
Well, you're welcome, but we haven't given it yet. So hang in there for one more minute. I think this is going well. We just need to vote on it again. We vote a lot, but we're good at it. Ms. Workman. I'm guessing you were going to move approval?
Oh, sure. Move approval.
Sure.
Seconded, Garcia.
It's been moved and seconded. Ms. Garcia. Ms. Severson, will you call the roll?
Thank you so much. Clerk Amundson.
Aye.
Director Barlow.
Aye.
Director Garcia.
Aye.
Director McLaughlin.
Aye.
Chair Marvin.
Aye.
Abstention noted for Vice Chair Nathan. Treasurer Workman.
Aye.
Thank you. Congratulations.
Congratulations.
And many thanks. Thank you so much.
No, wonderful. We're very pleased. Thank you. All right, we are moving on now to 5.02 Elementary Learning Model. This was briefed on January 5th. It is an action item, but before we get to reading the resolution, the superintendent, I think, has some data, some information he wants to share.
Yes, we thought it would be important to share the results of the teacher survey. So I'm going to turn it over to Carl Bakken, Executive Director of Human Resources, and he will share that information with us. Carl?
Here I am. Thank you, Superintendent. Are you able to see my screen with the Rochester Public Schools teacher survey results?
Yes.
Okay, great. Well, good evening, board members. I'm here to give you an overview of the survey results we did for all teaching staff. Okay. Presenting in Google here. So here I have this option. Okay. So this survey was developed with the input from the school board. We took the initial input that a couple of board members had submitted after the meeting where there was much discussion about this. We also took this to Meet and Confer, which is a group of teachers from various levels, cabinet members and superintendent and board members on there as well. Much discussion about it at that meeting. We took it back to cabinet, made some changes, and then finally it was all run past REA leadership. So we spent a lot of time on this, made a lot of tweaks to try and gather the best information that we could. The survey was open from January 13th to January 20th, and we had 1,131 respondents, which is about 68% of our teaching staff. The demographics, or the breakdown of the people who took the survey, you can see on this slide. 551 pre-K to elementary teachers, 419 secondary, 212 special ed or related service providers. And then we had an other group, and we just wanted to make sure we were capturing everybody. So some examples of who fell in the other group were adult basic ed. We had some substitute teachers that filled it out because they're on our emailing list. We had some people who checked more than one box. So for this, you're going to see people did have the ability to check more than one box. So for instance, I might check I'm an elementary, but I'm also a special ed teacher. They would show up in both groups. And that's where many of our others were, for instance, a K-12 vision impaired teacher. They chose other instead of special education, or they might have chose both. So there is some overlap between the categories. So what we did in the survey is we asked 2 questions for distance learning, hybrid, and in-person. The first question we asked is, which best describes your opinion about providing instruction through, in this case, the distance learning model? And we gave the choices: strongly opposed, somewhat opposed, neutral, somewhat support, strongly support. So that was the first question we asked. And you can see the percentages. When you look at, for a number of these, what I did is combined the somewhat support and strongly support and compared that to somewhat opposed and strongly opposed. So in this case, 67.8% of the respondents somewhat supported or strongly supported providing instruction through a distance learning model, while about 16% somewhat opposed or strongly opposed. Next, we broke it down into elementary, pre-K to elementary, secondary, and then special education responses, just to break those 3 groups out. I want to make sure my handout matches what's up on the screen there. So when we look at the pre-K and elementary responses, we see 36% strongly support, 60.3% either strongly support or somewhat support. When we look at secondary, you have 53.5 who strongly support. If you combine somewhat support and strongly support, you have 78.7. So with the secondary, in this case, you have more responses to the support of providing instruction through the DL model compared to, and less opposed compared to elementary respondents. And then if we look at special ed respondents, like many of the slides, I don't want to make you dizzy here, but if you jump back to pre-K and elementary, their response pattern was very similar to elementary. So the next question we asked about the 3 learning models: how confident do you feel providing instruction in that model? So in this case, if we look at all respondents for how confident they are in providing instruction in the DL model, if you look at mostly confident and very confident, you have about 80% of the respondents are very confident in their instruction in the DL model. Whereas if you look at the lower end here where there's very little or somewhat confident in their instruction, that's roughly 12%. Now when we break this down into elementary and secondary and special ed responses, you can see that we have about 77% that feel mostly confident or very confident in their instruction. With elementary, if we go over to secondary, again, it's tilted a little bit more towards the confident. So 87.6 are mostly or very confident. So again, secondary tended to be more confident in delivering instruction in the DL model. And when we go to special ed in this area, again, their pattern of responses more closely resembled elementary teachers. So now we're moving out of DL and talking about hybrid. So again, we asked that first question, which best describes your opinion about providing instruction through the hybrid model. And you see a more even distribution of results with hybrid and people's overall opinion about it. 52.3% somewhat or strongly oppose hybrid, while 33.1% somewhat support or strongly support hybrid. If we break it down into elementary and secondary responses, again, you see a more even distribution of the elementary responses compared to the secondary. 38.5% of elementary teachers who responded somewhat oppose or strongly oppose, while 46% somewhat support or strongly support. If we look at secondary, again, the responses tend to be tilted more towards opposing and less support. So 72.8% strongly oppose or somewhat oppose. Oh, sorry about that. And 16.2% somewhat support or strongly support. And again, special education, more similar to that elementary profile with a more even distribution of answers. So now we go to the question of how much confidence teachers have in the hybrid model and delivering instruction through the hybrid model. Again, here you kind of see a more even distribution of answers. 36.7% are very little confidence or only somewhat confident in providing instruction in the hybrid model, whereas at the other end, 47.23 are mostly confident or very confident providing instruction in that model. And if we break it down into elementary and secondary again, with elementary, 23% have very little confidence or only somewhat confident in instruction in the hybrid model, where 63% are mostly confident or very confident in the instructional model. If we go over to secondary, we almost see in the opposite, where the majority of responses, or 59.4%, have very little confidence or only somewhat confident in hybrid, and 24.4% are mostly confident or very confident. Again, special education, similar to elementary, this time slightly lower in their confidence ratings than elementary. And finally, we get to which best describes your opinion about providing instruction in an in-person delivery model. And you can see the percentages there. 53.3% strongly oppose or somewhat oppose providing instruction through an in-person model, while 36.83 somewhat support, or strongly support when we look at all respondents. When we break it down to elementary and secondary, fairly close here. If we take elementary, 51% somewhat oppose or strongly oppose, and 39.3% somewhat support or strongly support, where at the secondary, 57.9% somewhat oppose or strongly oppose, and 32.5% somewhat support or strongly support. Interestingly, the two most common answers with elementary were strongly oppose, followed by strongly support. Special education, again, in this case, was more strongly resembled those elementary responses. Then when we look at confidence, providing instruction in the in-person model, all respondents, 70% mostly are very confident providing instruction in person, while 16.9% had very little confidence or only somewhat confident providing instruction in the in-person model. If we break it down to elementary and secondary, when you look at elementary, 73.3% mostly are very confident providing instruction in person, with secondary 66.4% were mostly or very confident providing instruction. So in this case, secondary was just slightly less confident providing instruction with the in-person model. In this case, special education kind of fell, again, I don't want to jump around too much here, but they just kind of fell in between the two, the elementary and secondary responses. Some were closer to the elementary, some were closer to the secondary. Before we got into the open-ended questions, we wanted to get an idea. We feel this is a very important slide too, to find out what kind of supports teachers were utilizing thus far during the 2021 school year. And as we look at the responses to that, the number one response as far as supports utilized were colleagues in their building or program. 93.9% responded with that, and people could put multiple answers here. 2 was instructional coaches, followed very closely by the building program administrator at number 3, colleagues in other buildings and programs number 4, and help desk or the technology was number 5. And again, we have a good, when you look at the response rate, we didn't have very many skipped questions, so that's encouraging. We also asked 2 open-ended questions, and I guess the first thing I should say about this is there was a lot of overlap between the 2 open-ended questions. They were not, the responses did not create a distinct response pattern. So you'll see many of the same responses in these 2 lists. And what we did is we took the top 10 most frequent responses that we found. In this case, number 1 is by far, when you talk about what supports you need for the remainder of the school year, vaccination of staff prior to returning to the hybrid or in-person model was head and shoulders above the rest. It's about 6 times the number 3 on the list, and it was about twice as much as number 2. So when you look at number 1 and number 2 was about roughly 3 times when you get down to number 3 and below that. So those 2 were by far the highest. When you talked about vaccination of staff, as you looked through the responses, you saw a lot of things, not just vaccination, but if I don't get vaccinated or if I get ill, how it'll impact classrooms needing to go remote. Are we going to have enough substitutes? So you saw a lot of responses that came after I need to be vaccinated. When you look at number 2, time for planning, preparation, time to adjust schedules, create lessons, meeting with PLCs were just some examples that came up when people talked about time and and prep. Other more common answers, once you got past 1 and 2, adequate, comfortable PPE, having safety directions for that, clear communication on instructional expectations. There were a number of responses. Number 5, how do we teach hybrid more effectively, how to set it up, what it looks like. At secondary, how do we engage students? Number 6, mental health for both students and staff was mentioned. Probably more often concerns about mental health of students, but I would not want to leave off staff because that was a frequent answer as well. Internet technology training, information on what technology is available to engage students would be an example. We did hear, as far as number 8 goes, a number of people asked us to reconsider requiring face shields. And then 9 and 10, the middle school schedule, navigation, flexible schedule. And number 10, supporting getting kids back, and just some other examples there. You know, bring the students back full-time in person. Kids need to be in the classroom. Return to in-person learning. Children are suffering. So those are just some examples of the number 10 response for supports needed. And then we asked the open-ended question, what issues are important for us to consider moving forward? Sorry, I'll just jump back here. I did want to note, out of the supports question, out of the 1131 that completed the survey, 784 completed this question. So 69% of the people who took the survey answered this question on supports. And when we get to other issues, 874 out of the 1131 responded to this. So about 77% responded to this question of the people who took the survey. And again, when we get to this question, number 1 is about 3 times more than number 2 and any response after that. And number 1 is broad safety, so masks, cleaning, distancing, number of students in small spaces, testing of staff, just protecting staff from harm. You might see somebody who would write safety and then some examples, or they just might write keep us safe. And then once you got past number 1, which again was head and shoulders above the rest, then you get to curriculum needs, pacing, maps. We did see a number for number 3, the challenges of teaching both hybrid and in-person synchronously. Comments about teaching hybrid being difficult for number 3 as well. So again, here's that overlap that we saw with the previous one. Vaccinations made the other issues important to consider too. So you had a very strong number of responses of vaccinations for staff prior to returning to hybrid and in-person learning. So again, you might see someone who put vaccination for the first part of the question and vaccination for the first open-ended question as well as the second. Number 5 on the top 10 from our review was encouraging us to review county data and only move when we know it's safe to stay in that model. Number 6, cautioning about not giving in to pressures from parents or community members to return before it's safe. Number 7, most frequent, again, mental health of students and staff. Number 8 on this list, other issues important to consider. We saw that return our kids no matter what. Students need to be in school, just bring everyone back, or some examples of statements that we included in that. And then communication on instructional expectations and making face shields optional made it on this list as well. So that is the summary of the survey that we did with all teaching staff. If there are any questions.
You know, Mr. Bakken, if it's all right with you, I think the most productive use of this time would be for me to read the resolution, and then if you would answer questions specific to that. So the resolution as we have, and again, this is an action item, and I would just remind board members and others, the first line is the one we're really going to be dealing with. After that, it's basically giving the superintendent and the board permission to make changes quickly if the conditions in the district really change. So the Item is, be it resolved that the School Board of Independent School District 535 directs the superintendent to implement a full in-person model at the elementary pre-K to grade 5 beginning on March 1st, 2021. Be it further resolved that the School Board of Independent School District 535 authorizes the superintendent, after consultation with the school board chair and notification to the school board, to select and implement a different learning model for the school district or any specific school buildings without school board action if the superintendent reasonably believes that prompt implementation of a different learning model is necessary and that constraints of time and public health considerations render it impractical to hold a school board meeting to approve the implementation. The learning model selected and implemented by the superintendent shall continue in effect unless and until the school board, in consultation with the superintendent and appropriate school district staff and public health officials, deems it to be in the best interest of the school district and its students to implement a different learning model. And be it further resolved that the School Board of Independent School District 535 directs the superintendent to provide regular updates to the school board regarding the school district's efforts to implement COVID-19 related educational and public health guidance issued by the MDE and MDH respectively. If we have a motion to approve in a second, then we can have discussion on this resolution. Mr. Barlow, thank you for moving approval.
Second, Nathan.
Second by Ms. Nathan. Thank you. Any discussion? Ms. Workman.
Thank you. I heard a whole lot of data being presented to us, so I'm assuming that that's, those are the things that you took into consideration when making this recommendation. I'd like to make the observation that in both elementary and secondary, that hybrids seem to be the least favorite choice of all of those. Another observation I'd like to make is that the secondary, which has not yet experienced hybrid, has seemed to have a considerable number of questions and concerns about how that would be implemented. My question, now that I've made a few observations, is why did you choose the date of March 1st as opposed to the date of March 8th, which is the start of the third trimester after grades have been done, or evaluations, whatever, on March 5th, which is a teacher work day?
Yeah, I can respond to that. That's just part of the rollout process. You have to do pre-K2, then 2 weeks later you can do 3 through 5, and then you can 2 weeks later you can do full in-person pre-K2. 2 weeks later you can do 3 through 5. So it was just all part of that original recommendation that was made at the board, and then we decided to wait until this night to see if we want to continue moving forward with it in that direction.
Has there been any response from elementary teachers about any concern with the rollout happening before the end of the second trimester? Is that something to be concerned? I mean, is that a moot point as far as they're concerned?
It hasn't been brought to my attention, but I do know in the many years that we've worked on the calendar for Meet and Confer, it's more at the secondary level when you talk about numbers of days per semester. It really hasn't been an issue on the number of days as part of a trimester, but I'm not aware of any concerns that at least have been brought to my attention.
I think my question was geared not so much as the number of days, but the fact that they would have a conclusion to the second trimester on March 4th. Doesn't matter if the students come back full-time on March 1st. Would you anticipate that would make any difference in how they teach or how they would relate to their students as they come back? Maybe somebody else can jump in if anybody has a clue as to what I'm saying.
No, I know what you're asking. I guess we don't know. A concern has not been brought to my attention. Okay. I think when you get into the secondary and then you start getting to those, for example, at the middle school, you have the exploratory classes that are only so many weeks, and then they shift into a different one, or you have semester courses at the secondary level, whereas the elementary, it's the same group of kids the entire school year. So I don't anticipate any, but there haven't been any concerns brought to my attention.
Okay, thank you.
Ms. Nathan.
So I think my question builds on Dr. Workman's, but I think it clarifies it. The resolution says full in-person model beginning March 1st, but the actual structure of the implementation, and tell me if I'm wrong, is that pre-K through 2 would go in person on February 16th, and grades 3 through 5 would go full in person on March 1st, which would mean that by March 1st, pre-K through 5 are all in person. But when you talk about the rolling start, we're actually starting it on February 16th under this proposal. Is that right?
Correct.
Okay. So when you say in person, is it a 5 days per week in person?
Yes, it's just basically a full pre-pandemic type schedule. We would try to maintain as many of the mitigations as possible, still try to keep, students in their classroom and maybe bring art and music to the classroom instead of taking them out in a hallway and headed down to the music room or art room. But it would be much more difficult to do that social distancing in the classroom when you're full in person because you have more students, more desks. But it would be the normal schedule that we would follow as if we weren't in the pandemic.
Okay, so one question about the social distancing. The biggest difference and the biggest change in requirements between hybrid and in person is that we're not required to have a 6-foot or a 3-foot space, although it's recommended. And you just said that'll be very difficult in the classroom. And we have 100% of the students who are choosing the hybrid model in the building at any one time. And we also have 100% of the students traveling on the buses with no social distancing.
Correct.
Okay.
So if I could jump in here, I'm wondering if we have considered, I'm going to say this, and I know it's a huge frustration to parents who want to know the plan and then stick to the plan, but I'm wondering if we've considered continuing to provide hybrid for all of our elementary school students until March 1st, and then bring them back in person, full in person on March 1st. Rather than have some kids going back in just a couple of weeks, if we could give the schools about 4 more weeks, possibly, hopefully, more of our teachers will be able to get vaccinated by that time. But then bring them all back on March 1st in person, again, assuming that the numbers haven't spiked.
Yeah, the only thing we would have to do is get permission to not do a rolling start when we shift from hybrid to full in person. I don't know how MDE would respond to that, but we can put in a request and ask that question if we could not do a rolling start at the elementary level and see what they say.
Thank you. Ms. Nathan, did you have another question?
Well, I guess I want some clarification from the superintendent on how that affects our decision tonight. So if the resolution right now reads March 1st, and the will of the board is to do what Director Marvin just said, which I think I got right, is to delay bringing everyone back pre-K through 5 on March 1st. And let's say you find out from MDE that you can't do that. You have to do a rolling start. How would we modify what the board decided tonight on that? Would we start pre-K2 on March 1st and then 2 weeks later bring back 3 through 5, or what would you see happening?
I think it depends whatever resolution it is passed by the board. If you modified the resolution tonight and went to what Chair Marvin suggested, if we wouldn't get approval for that, I do know we have a couple study sessions scheduled already. We could try to get an answer from MDE yet this week on that question. And if for some reason they say, no, you can't forego the rolling start, we could schedule a business meeting before the study session next Tuesday. I think we would just have to know that, I think, by Thursday, so we could get the agenda posted out there. So we would try to work extremely hard to try to get an answer yet tomorrow or Thursday morning for sure, just to give us time to adjust and add a business meeting to next Tuesday's study session. So you could take action, and we could come back with the original resolution and you could take action on that one.
Mr. Barlow.
Question. So Superintendent Munoz, are you aware of any other districts who have attempted to not be in compliance with the rollout, and how successful were they or not?
Yeah, I'm not aware of any. I do know this was kind of crazy and it was very confusing for a lot of people, but before the governor made his announcement in mid-December, if you had already communicated with your family that on this date we are coming back to hybrid or we're coming back to full in person, you weren't required to do the rolling start piece of it. But since we had not made any kind of commitment on what type of learning model we were going to do prior to the governor's announcement, we just said that on January 8th we would tell you what we're proposing. That required us to have to do the rolling start. I'm not aware of any district that has done what we're talking about right now, where they've started a rolling start and then to the next learning model they're going to bypass the rolling start. That doesn't mean that that's not out there. I'm just not aware of anybody in this area that has done that. And to be honest with you, I don't know if it's a direct question to MDE or if we have to reach out to our regional support team to get an answer from, but we could find that out tomorrow morning.
Ms. Nathan, another question?
I will let someone else ask first.
Thank you. Any other ideas, comments, questions, Ms. Amundson?
I just wanted to go back and thank the staff who put together the survey and put together all those results, because there were a lot of comments, and for them to be able to go through them all and summarize them for us like that, I appreciate it. I think it makes us all more informed, and I think it makes the staff heard. So I just wanted to acknowledge the tremendous amount of time that went into that. And since I was one of the people who requested it, I wanted to express my gratitude. But I also wanted to make it clear to those watching at home that you know, this is just one piece of evidence, and it's being presented today because it's new information, and that there are multitudes of factors being considered in this decision. I feel like sometimes when people only tune in for the board meetings that, you know, are high visibility, they may not realize that there's a lot of different factors and a lot of education that goes into it. So I was hoping that someone could summarize or loop back to exactly what it is we're being asked to suggest or approve or not approve or edit? I mean, there's been a lot of discussion that has taken place so far about what if we do this and what should we do that. So if somebody could, I guess, put something concrete forward.
The resolution as it was read is would have our students, our elementary students who are now all doing hybrid, would have pre-K through 5th graders coming back, pre-K through 2nd graders coming back in person full-time beginning February 16th, and then 3rd through 5th graders coming back full-time in person March 1st. That's
Right,
what the resolution.
I heard some discussion about, you know, what if we asked for permission to bring back, I'm just wondering where we are on that modification.
We're not anywhere with that one, and that one would be just to keep the kids hybrid. And I know that it's problematic for parents. I know that staff isn't crazy about the model. My way of thinking about that, however, was twofold. One, that if we had an uptick in cases, you know, there's some prediction that things are going to get bad again, we'd have to pull everybody back to distance learning. And so it would be from hybrid to in-person to distance learning.
Mm-hmm.
And that hopefully by March 1st, we would have a good sense about where that was going. And we would also perhaps have a better chance of having more of our staff vaccinated.
Right, so I wasn't clear before because my brain is trying to process a lot at once. I'm sorry, I'm not very effective when I'm thinking about a lot of things. Are we brainstorming, or are we considering only the proposal that's in front of us? That's what I should have asked.
And that's a good question. We're considering the proposal that's in front of us. I guess I offered something that could be considered an amendment. It's not a big difference, but it's a difference. It would mean that the pre-K through 2nd graders would stay in hybrid 2 weeks longer than their families are currently assuming that they would. Ms. Nathan.
I believe other people were before me, so I'll let them go first.
Oh, all right. I just saw your hand in that, and I'm seeing Mr. Barlow's hand.
Well, there's a motion on the floor, isn't it? I guess I want to be clear in where I think we are. Is that correct?
Yes, yes.
So,
yes.
Okay, thank you. I just wanted to be clear of that. Thank you.
Okay, and I cannot see hands other than Ms. Nathan. So if someone else has a question or a comment, would you, Ms. Workman, thank you.
Yeah, I have a question. Did we vote to, at what point did we vote to approve the rollout of the K through 3 on the 16th of February? My only reason for asking is there isn't anything in this particular resolution about K through 3. So that must have been done at a previous meeting. I was just looking on board docs and not finding it, but that doesn't necessarily mean it's not there.
Yeah, correct me if I'm wrong, that was briefed on January 5th.
Okay. I was looking on the 19th.
Clarify, we have not voted to bring anybody back on February 16th. The only vote we took was to bring the students back hybrid, and we delayed making a decision on the February 16th, March 1st rollout.
Right.
Until tonight.
So that would mean that unless there's an objection from MDE, that this resolution would mean that we would be bringing all kids K through 5 back in person on March 1st.
Well, the resolution as it reads right now is that we would stick with MDE rollout requirements. Half the kids would come back February 16th face-to-face, the other half would come back, or in person, the other half would come back on March 1st. And that would be following the rolling start.
Okay.
Is there other discussion, or do you want to vote
I
on
think
this?
Director McLaughlin is, her hand must be hard to see because she's raising it.
Oh, thank you. And I can't see it. I can't see her name anywhere either. Thank you for that, Ms. McLaughlin.
And I'm at the bottom of the screen, so that's probably just why I apologize. But I guess as a new board member, I'm confused in the sense that the resolution as presented in our agenda talks about moving pre-K through 5 to full in person on March 1st of 2021. Is that what we're voting on, or are we voting on something different? Does that need to be amended before we vote?
Well, and that's a good point, because the proposal, I think you could read it one of two ways. The way it is intended to be is K2, pre-K through 2, February 16th, in person, 3 through 5, in person, March 1st. But you're right.
That begs my question.
It's not clear. It's not clear.
Why isn't the resolution drafted in a way that it was intended? Is my question.
Ms. Amundson.
Both Director Workman and Director Nathan had their hands up before me, so I will wait my turn.
We're so polite. Okay, Ms. Workman.
My hand shouldn't be up. I'll put it down. Thank you.
All right, thank you. Ms. Nathan.
So I'm going to agree with Director McLaughlin as far as the slight confusion on the resolution. For me, I clarified it because this was briefed at the January meeting, and the way it was presented by the superintendent was that this resolution would take us to pre-K through 2 on February 16th and 3 through 5 on March 1st.
Right.
What I'm hearing is a discussion from Director Marvin that we could amend the resolution to be more clear that the board's will is to bring grades pre-K through 5 back to in-person learning no earlier than March 1st, pending approval by MDE of not doing a rolling start. That, to me, are the two options on the table. If we feel we have to clarify the resolution by being explicitly specific on saying pre-K through 2 on February 16th and 3 through 5 on March 1st, that to me is also an alternative amendment to the resolution if that's the will of the board. But those are the three ways I see the options on the table.
Ms. Amundson.
Well, one way or another, I think we need to be explicitly clear, because if I'm confused, everybody else is confused who's at home, and parents are going to want to know, and staff is going to want to know what exactly it is that we're approving. So I think more direction is better, and I'm not saying what to amend it to, but I think maybe Director Nathan has that vision and could do that. One way or another.
Okay. If I may, Director Marvin, then I'm just going to offer an amendment to the resolution.
Thank you.
And we can discuss it in a specific context instead of guessing which one we're amending it to.
Okay.
So I'd like to amend the resolution. Be it resolved that the School Board of Independent School District 535 directs the superintendent to implement a full in-person model at the elementary pre-K through grade 5, strike out beginning on, and add no earlier than, add no earlier than March 1st, 2021.
And to clarify, that amended resolution would mean that the agreement was that everybody stays hybrid in elementary until March 1st, until March 1st at the earliest.
That is, yes, that is the intent of the amendment.
Okay, so let's vote on that amendment. That doesn't mean we're voting to it.
No, we need a second, sorry.
Right.
Second, Workman.
No. Okay, but what I was going to say is, let's go ahead and you've moved that. Let's have it seconded. Let's vote on that amendment. And Michelle's shaking her hand.
Discussion first.
Right. But that doesn't mean that we would be approving the amendment, not the resolution.
Right, but there's discussion on the amendment before we vote on the amendment.
Right. Hang on for 1 second. We're having a discussion about Robert's Rules of Order. I think at this point, it's been moved, this resolution's been moved to action. So perhaps the thing we need to do is vote this one down. And then, because there's confusion about what it means. And then Ms. Nathan, you could propose your resolution that we could discuss and then vote on that one.
I think it's appropriate under Robert's Rules of Order to amend a main motion, and the main motion was the original resolution. So,
yep.
I mean,
No,
we can do it either way.
No, the discussion we're having here is because it's been moved to action, can we amend it now? I thought that we could, but I may be wrong.
Yeah. My reading of Robert's Rules of Order is that you can, moving it to action makes it the main motion, and you can amend it. So.
All right. Let's go with that.
There's been a movement and a second, so we have to vote on the amendment, on whether to amend it or not now.
Right.
I think we have to.
So, Ms. Nathan, would you read your amendment again, please?
Okay. Be it resolved that the School Board of Independent School District 535 directs the superintendent to implement a full in-person model at the elementary pre-K through grade 5 strikeout beginning on and add no earlier than March 1st, 2021.
Right. It's been read. Is there a motion to is there a second?
I seconded it the first time around, but I'll second it again.
It's been seconded a couple of times. Discussion.
So I guess I should speak to my amendment.
Yes.
So I have been thinking about how to summarize this, because there's obviously a boatload of information that we have received in terms of emails and both from parents and teachers. We've been forwarded surveys. We've heard from Mr. Briggs. And I think the piece that resonates with me the most is what the Centers for Disease Control said. And what they said was, it's safe to go back to schools if. And the if criteria for me are very big. And I think Mr. Briggs confirmed them tonight. If the mitigation strategies are in place to protect our students and staff, it's safe to go back to the schools. All of the studies that I've read, Mr. Briggs confirmed it tonight. Those mitigation strategies are what we currently have implemented in our hybrid model. Though one of the biggest mitigation strategies of social distancing, both in our classrooms and on our buses, would go away if we implemented an in-person model. So for me, I was not comfortable moving us to an in-person model in 2 weeks, February 16th, especially knowing we're so close to vaccines, and by March 1st, we'll have a much better handle on the vaccines for our pre-K through 5 teachers and staff, and we'll have a much better handle on the mitigation strategies that are being implemented with Fidelity and Hybrid. And it's I know 2 weeks longer for parents who really want their kids to be full in person tomorrow. But I think the back and forth potential of quarantine and switching from a hybrid model to a distance learning model is what I'm hearing from teachers. It's disruptive for them and it's disruptive for the students. So that's why I propose this amendment.
Thank you. Ms. McLaughlin. Ms. McLaughlin, you're muted.
I put my hand down and then I don't talk. I would echo what Ms. Nathan is saying. My reading of the CDC information was originally, it was an opinion piece, but that the CDC ultimately did adopt those recommendations, specifically the physical distancing, social distancing that Ms. Nathan was talking about. I also made some notes of that document that screening testing was also in the criteria for mitigation, as well as putting a stop to in-person sports, particularly inside. I took the survey data to heart in the sense that our teachers, who are our people, are talking about their safety, and that is critical to our workforce to maintain our schools having any semblance of learning or even being open. So I think that that's critical to keep in mind. I also think the one downside of what's being proposed here is that we're giving less certainty in this resolution, in this amendment, but I think that it fits what Mr. Briggs has been telling us tonight and all of the information we've been receiving throughout the last couple weeks, that I think it's the safest thing to do for our teachers and our students, knowing that our teachers are the lifeblood of our schools.
Thank you. Mr. Barlow.
Yes. Well, my concern is this resolution didn't just come upon us unaware, okay? And this is something we've been aware of. It is something that was proposed by the superintendent and cabinet. I think our viewing public perhaps even anticipated, because they've had opportunity as well to read what would be proposed and what they believe would be voted upon this evening. And I'm not that I'm a stickler, I'm flexible, if you will, but so what happens in 2 weeks, 3 weeks? I mean, if we keep changing, now I say we, really the lay of the land, the COVID, the pandemic itself, the numbers are seemingly, it's driving everything. And yet, personally, I'm not necessarily opposed to working toward, I believe, what is a common goal for each of us, to just allow me a moment to, I think we each have had the opportunity to sense the passion and frustration of the moment, as well as at the time hoping for a better tomorrow, if you will. Is it really possible that in this instance all roads do lead to Rome? Meaning, is it distant learning, hybrid, in person? I believe that we all want the same thing. Okay, a safe and speedy return to the classroom based on the relevant science, okay? A safe and speedy return, not to what was, but a leap forward into the unlimited possibilities of what can be. I simply share this, that it's my belief that now, more than ever, educational disparities, and it's important upon BIPOC students as part of, if you will, mainstream conversations. People are getting it. This has everything I believe to do with the motion or amending the resolution before us. I think we have a more engaged and involved community than ever before. I believe it strengthens our educational system like never before. And I believe the community just wants to know that we know what we're doing, and we give evidence of that by being decisive in what we do. And I came prepared to vote on the resolution as listed. And so I will hear the rest of the conversation, but I'm prepared to vote on the resolution as originally presented.
Thank you, Mr. Bartle. Ms. Workman.
I think another thing to consider, and you briefly touched on it, Chair Marvin, I believe, was the idea that once students are back in school full-time, what's going to happen, if we have to go back to the hybrid or complete distance learning. And a lot of this is incumbent upon the community to really help us out with this. And by that I mean that it was shown or discussed tonight that teachers are not getting COVID so much from each other, although perhaps there are a few, but that it's being brought into the building. It was also mentioned that there are people who are taking extreme precautions to avoid exposure to COVID. So they are at greater risk through no fault of their own if there are people who are taking fewer precautions and therefore bringing COVID into the building. So what the community can do for us is to really lower the risk of the community. And if we continue to have a lot of community members who don't observe the recommendations that are being made in terms of staying safe, our teachers will be more exposed to it. And once that happens, then, and we haven't even begun to discuss this, at what point do we say we have to shut an entire building down as opposed to just quarantining a classroom? I'm firmly of the belief that our teachers absolutely want to be back in the classroom with their students. I am firmly convinced that everyone on the board also shares that desire. But this yo-yo effect of bringing them back to school, sending them back home, bringing them back again is really not conducive for good student learning when kids' routines are having to be changed so frequently. So with that, I would say I support the amendment as provided by Director Nathan.
And let me just quickly respond to what you were saying too, Ms. Workman. One of my biggest concerns is, I mean, we've already had 36 adults in 1 month of being back in the classroom, 36 adults who've tested positive. We know that we've had outbreaks or cases found in our elementary schools. When we have to quarantine teachers and their students, that's the real yo-yo effect. They're there and they're back. And this is only with hybrid so far. We haven't had full classes back. So my biggest concern is how do we get our kids in school and keep them there? And it could be that 2 additional weeks won't matter. Maybe it will. Okay, Ms. Amundsen, and then Dr. Garcia and Ms. McLaughlin.
I think the consistency is important. In terms of, I call it the whiplash effect.
Yep.
I think that's difficult for students and families. I mean, we hear from a lot of families that they're under a lot of pressure, and I really empathize with that because you know, it must feel like a pressure cooker at home to have kids who are trying to do school things and parents who are trying to work, or to not have a place for your kids on the days when they're not at school. And I get that. And I'd like to see our kids back in school, but I'm not convinced that switching back and forth prematurely is going to help that pressure cooker feeling either. I also think that if I were a family who had 1 child in the K2 range and 1 child in the 3-5 range, and for those couple of weeks when they weren't doing the same thing, that lack of consistency would increase the pressure as well. And so for those reasons, I am in favor of the amendment to try to have both groups doing the same thing at the same time. So if I'm understanding correctly what the amendment is, the problem I'm still having is the wording no earlier than, because I'm afraid that it won't communicate to the families exactly what it is we're aiming towards, like what date. To me, that it seems like we're saying, well, we're not going to do it now and we might do it later. So if somebody could just verify for me that it doesn't mean that we aren't planning to do it as of that date. We are planning to do it as of that.
Okay, and if need be, we can amend the amendment, actually. Dr. Garcia.
Yes, I just wanted to sort of clarify or ask somebody else perhaps to just summarize the data about the closures or the quarantines that we've had in schools, because right now I'm sure to the public, unless they're in a school that has already had cases, they probably have no idea what we're talking about, moving people back and forth and going in and then leaving and then not. It just sounds like we're talking about this, the possibility that we might have to go back to distance learning. So I think you started, Chair Marvin, to mention that there were 36 adults. I can't remember, it was like 6 or 7 schools already that have had positive cases, or perhaps more. I think the community probably needs a little more context, because obviously they don't get the data aggregated in the same way that we do. And so if they're only looking from their own lens, what we're talking about is probably lost on a lot of people, and where we just kind of plucked this idea of the yo-yo effect, and why we're making the amendment that we're making.
Good point. And Superintendent, I don't know if you have that information in front of you.
Yeah,
right
I do not have the updated COVID dashboard, but I can share what we experienced in the fall. We did have 2 buildings that we had to shut down, or I should say programs, for 14 days because we just had so many staff that were either positive or quarantining. So we had to shift them to distance learning for 14 days. We did have 1 elementary that was 1 staff away from having to quarantine the entire elementary building. I would say probably in the most we had, I think we had 1 elementary where we had to quarantine a whole section of a grade level for 14 days and shift them to DL. But that's kind of what we experienced during the fall. I don't, like I said, I don't have the dashboard here in front of me to really give the exact numbers, but I can tell you we did have to quarantine some buildings and some grade levels because of positive cases by staff.
Yeah, last fall we had 714 staff and students in quarantine, and Ms. Nestler just put in the chat at the site where you can go to look at the numbers. But I know that we had outbreaks in all of our elementary schools that were, and all of them were in hybrid at the time. And we have the numbers, and I think maybe that's what Ms. Nestler was bringing up from the last couple of weeks. She's got that as well. Anyway, if you look in the chat, you can find, I think. Oh, there you go. Thank you, Ms. Nestler. Heather, do you want to just quickly give people who are having trouble reading that a quick run through?
Sure. So good evening, and I will go through this really briefly with you. The top number on the left-hand side is the total number of positive cases that we have had since the beginning of the school year, which is early September. And underneath that large number, 430, you can see we break it down by staff, as well as our pre-K through grade 6 or grade 5 students and our grade 6 through 12 students. On the right-hand side, you'll see the total number of staff that have been quarantined, and that's 1,288. And again, we break it down by staff pre-K through grade 5 and grades 6 through 12. And I want to point out that this is only the numbers that we know based on what is reported to the school district. So there might be cases that we're unfamiliar with, and especially when we were in distance learning, where there were some positive cases, but we may not have known about them. And then we update this on a weekly basis, but the data is always 1 week behind. So if you look just beneath those first two rectangles, you'll see the number 26 on the left-hand side. That was the total number of new cases, new positive cases for January 25th through the 31st. And then again, we break that down between staff pre-K, grade 5, and grade 6 through 12. And just across the way from it, number 89, you'll see that is our number of staff that are in quarantine that particular week based on the cases that correspond to the left on number with the 26. And then we provide the week before, the data from the week before as well. And I know the superintendent is sharing this right now, but we have all of the dashboards since we started sharing this information, and it says archived information on the screen. So you can see that beneath here. We also try to point out the fact that right now we're only in hybrid. So, there's a lot of different factors here, but we point out the fact in just this little byline here that we're in hybrid right now, grades pre-K through 2, and then the rest are in distance learning. And so that'll change next week since now we've brought back our grades 3 through 5 in hybrid. I hope that helps explain it, Chair Marvin.
Thank you. All right, I think Ms. McLaughlin, you had a question.
I did. I wanted to agree with what Ms. Amundsen said about the consistency, that I think that's kind of the theme that we're talking about here. The one other thing I wanted to add to the discussion, though, is that one of the things that I've been thinking about as a difference, perhaps, of Rochester Public Schools compared to other schools is the issue of classroom size when we're talking about physically distancing. Not only the classroom size, meaning the number of students in each class, but the physical classroom size, perhaps in some of our older buildings compared to some of our newer buildings, that some of our buildings have some fairly small classrooms with some fairly large class size of students. And that's one of my concerns about physical distancing, which leads me to conclude that I would support this amendment, because I think that every teacher that we can get vaccinated prior to returning the elementary students into in full in-person learning will benefit the safety of everyone.
All right, and I think we're getting to the point where we're almost ready to vote on the amendment. Ms. Nathan.
And now I'm going to remember my question. I think it was on the data that I think what I heard Ms. Nestler say was that these numbers on this dashboard, the 125 individuals in quarantine, have just been when we've had pre-K through 2 in hybrid. Everybody else in distance learning. And then I think I heard the superintendent say that when there is a quarantine, it's a 14-day period. So if the purpose of this amendment is to simply delay 2 weeks, everyone being back in person, what we could be avoiding are a number of students having to miss those 2 weeks of being in person anyway, because they could be exposed and could have to go into quarantine for 2 weeks. So I agree with everybody's comments about the yo-yoing back and forth and the consistency that the March 1st date brings, hopefully more consistency to the learning model going forward.
All right, at this point, I think we're ready to vote on the amendment. Again, we're not voting on the resolution, just can we amend the resolution? Ms. Severson, would you call the roll?
Thank you. Clerk Amundsen.
Aye.
Director Barlow.
Nay.
Director Garcia.
Aye.
Director McLaughlin.
Aye.
Chair Marvin.
Aye.
Vice Chair Nathan.
Aye.
Treasurer Workman.
Aye.
Thank you.
At this point, then, we have a new resolution. And let's vote on that resolution again, remembering, I'm echoing. Thank you. Again, remembering that we do not, we'll move this one to action and then we can discuss it further because there may be going back to the original intent of the resolution that we'd prefer to vote on. So the resolution as it stands now, and Director Nathan, correct me if I don't have this right. Be it resolved, the School Board of Independent School District 535 directs the superintendent to implement a full in-person model at the elementary pre-K through grade 5 no earlier than March 1st, 2021.
Move approval. Workman.
Second, McLaughlin.
It's been moved and seconded. Any discussion? All right, Ms. Severson, roll call vote, please.
Thank you. Clerk Amundson?
Aye.
Director Barlow?
Nay.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
Treasurer Workman?
Aye.
Thank you.
And now that I've said that, I did not read the entire resolution. I just read the part that was amended. And I apologize for that. Do I need to read the entire amendment, the entire resolution again? I'm sorry. I'll try to do it quickly. Totally my mistake. I'm sorry. Here it is. Be it resolved, the School Board of Independent School District 535 directs the superintendent to implement a full in-person model at the elementary pre-K through grade 5 no earlier than March 1st, 2021. And be it further resolved that the School Board of Independent School District 535 authorizes the superintendent, after consultation with the school board chair and notification to the school board, to select and implement a different learning model for the school district or any specific school buildings without school board action. The superintendent reasonably believes that prompt implementation of a different learning model is necessary and that constraints of time and public health considerations render it impractical to hold a school board meeting to approve the implementation. The learning model selected and implemented by the superintendent shall continue in effect unless and until the school board, in consultation with the superintendent and appropriate school district staff and public health officials, deems it in the best interest of the school district and its students to implement a different learning model. And be it further resolved, the School Board of Independent School District 535 directs the superintendent to provide regular updates to the school board regarding the school district's efforts to implement COVID-19 related educational and public health guidance issued by the MDE and MDH respectively.
Move approval. Workman.
Second, McLaughlin.
It's been moved and seconded. Ms. Severson, roll call vote again.
Thank you. Clerk Amundson?
Aye.
And Director Barlow?
Nay.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
And Treasurer Workman?
Aye.
Thank you.
Chair Marvin, you're muted. I see your mouth moving, but I hear nothing.
Thank you. I'm just getting hoarse from reading. 503, the secondary learning model. This was briefed on January 19th. Superintendent, do you want to say anything about this one before I read the resolution?
No, we don't have any additional information. We shared the secondary staff results with their previous agenda item.
All right, here is the resolution. Be it resolved, the School Board of Independent School District 535 directs the superintendent to implement the following secondary learning model transition to hybrid for grades 6 through 12 beginning on February 23rd, 2021. And be it further resolved, the School Board of Independent School District 535 authorizes the superintendent, after consultation with the school board chair and notification to the school board, to select and implement a different learning model for the school district or any specific school buildings without school board action if the superintendent reasonably believes that prompt implementation of a different learning model is necessary and that constraints of time and public health considerations render it impractical to hold a school board meeting to approve the implementation. The learning model selected and implemented by the superintendent shall continue in effect unless and until the school board, in consultation with the superintendent and appropriate school district staff and public health officials, deems it in the best interest of the school district and its students to implement a different learning model. And be it further resolved that the School Board of Independent School District 535 directs the superintendent to provide regular updates to the school board regarding the school district's efforts to implement COVID-19 related educational public health guidance issued by MDE and MDH respectively. Again, this model was briefed on January 19th. That's the resolution. Do we have a motion to approve in a second? So we can discuss.
Move approval.
Thank you, Mr. Barlow. Is there a second? Is there a second? If there is not a second, the motion does not go forward. Discussion about how you'd like to proceed.
I'd like to propose, so it fails for lack of a second?
It fails,
Is that my
exactly,
understanding?
exactly, yes.
Okay, so I'd like to propose a motion.
Go ahead.
Be it resolved that the School Board of Independent School District 535 directs the superintendent to implement the following secondary learning model, full in-person, for grades 6 through 12 beginning on April 5th, 2021, and be it further resolved that the School Board of Independent School District 535 directs the superintendent to provide an update to the school board at the March 16th meeting on educational and public health guidance to confirm the full in-person implementation on April 5th, 2021. And be it further resolved that the School Board of Independent School District 535 authorizes the superintendent, after consultation with the school board chair and notification to the school board, to select and implement a different learning model for the school district or any specific school buildings without school board action if the superintendent reasonably believes that prompt implementation of a different learning model is necessary, and that constraints of time and public health considerations render it impractical to hold a school board meeting to approve the implementation. The learning model selected and implemented by the superintendent shall continue in effect unless and until the school board, in consultation with the superintendent and appropriate school district staff and public health officials, deems it in the best interest of the school district and its students to implement a different learning model. And be it further resolved that the School Board of Independent School District 535 directs the superintendent to provide regular updates to the school board regarding the school district's efforts to implement COVID-19 related educational and public health guidance issued by the MDH and the MDH respectively.
Thank you. That's the resolution.
Second, Workman.
It's been seconded. That was the resolution. It needs to be moved first. I heard that you moved to
Move
approve.
it, whatever,
Okay.
to approve. Yep.
And
Well,
Ms.
Vice Chair, by reading
I
it.
moved it, right. I moved it, Jean.
You
Julie
moved,
seconded.
sorry. Okay, thank you.
And I seconded it.
Okay, thank you. Any discussion? Ms. Amundson.
I would ask Vice Chair Nathan to provide reasoning as to the change.
Sure. And just to be clear, the The change from the original proposal to the last two paragraphs are the same. There are standard components. It's the first two that are different. So the first is a move to April 5th. April 5th is the first day of fourth quarter. Taking into account the volume of comments on the staff survey, the fact that 1,100 people commented, or 1,100 people took the survey, and their support or their lack of support for going back in a hybrid model resonated with me. We received a number of very detailed emails from staff who described how they felt the hybrid model would not work, and that if they were allowed to plan for an in-person model, beginning at a natural break, such as the end of the third quarter, they could make it work much more effectively and much more a positive experience for students. Obviously, the vaccination is an important issue, especially for our secondary staff, and I think Mr. Briggs confirmed it tonight, that he was comfortable talking about elementary going back to school in a hybrid model, but he did not feel as comfortable about secondary because of secondary transmission. And frankly, our lack of experience at all of seeing how those transmissions might occur in the secondary, because we haven't been back. And then finally, a number of teachers made some really strong cases to us about what we can do in the meantime if we're going to stay on distance learning for the last part of this quarter, that there are innovative strategies to bring students back to buildings. In not just the groups that we've had back in buildings for those face-to-face services, or who requests it on asynchronous Wednesdays, but how we could intentionally bring the sixth graders and the ninth graders who haven't had that transition to middle school or high school. The seniors to do some of the things that seniors need to do in their final year. The students with credit recovery needs because of their grades in first semester. So this gives the message I heard from secondary teachers is that they needed the time and the space to plan to be comfortable being in-person learning. And I heard that there are many opportunities to provide supports for students for the distance learning period for the rest of third quarter.
And if I could just add to that too, that the proposed hybrid model would be 7:40 to 1:30 or 7:40 to 1 o'clock. And a number of staff and students, as well as parents, said it's going to be impossible to go from, well, it's not going to be impossible, but to have to go from the block schedule that students are currently experiencing to an 8-period day with a number of very short classes with transitions 7 times a day is going to make this learning model worse than distance learning. The students, of course, want to get back into school, but students actually were saying that this isn't going to work for them academically, and that especially if our staff is committed to bringing kids back in small groups, providing that kind of interaction for small groups rather than 900 at a time, that it would be better. And although the hybrid model is not popular among most, in the high school and middle school, when you have each staff member with maybe 140, 160 students and possibly 3 or 4 different preparations, it makes it almost impossible to do anything that approaches being academically sound. Ms. Amundsen.
So what I'm hearing is that we want the high school kids to go back when they can go back full time, everybody in person. We want to skip over the hybrid stuff.
Yes.
And this is based on input from staff, and you said we're hearing from students Chair Marvin, can you tell us where we've heard from those students?
Well, we've heard from students, for instance, in the student school board, both middle school and high school kids, and they've talked specifically about distance learning. And surprisingly, their comments were pretty positive. They miss their friends, but they said that the teachers are doing a good job of giving them a good education. They're into it. They get how it works. We talked briefly about hybrid, and they seemed confused about how that model could work. They like the block schedule that they're on currently. They were not keen about going back to an 8-period day. And then I've just had phone calls as well from students who wanted to they had questions.
And I appreciate all of that. I would request that student input received via student school board that will be used in a future agenda item, that be provided to the board in advance, please. Just so we can all have the same information when we're sitting down together.
Oh, okay.
I respect the input. I would just have like to be able to think about it ahead of time.
No, thanks. You asked me where it came from, so that's where
that answer
came.
And I think it's a fabulous way to get input. I would just say not all of us are privy to that, so I would just request a summary or something so that we have time to process that a couple of days in advance.
I hear you. Thank you. Ms. McLaughlin.
You're still on mute. Still muted.
I wasn't very articulate anyway. I would supplement that with the fact that some of the teachers' emails to us included very anecdotal surveys from their students in their classrooms that they have with distance learning right now. And I think that informed us that the students did have viewpoints on this, and that distance learning is something that everyone recognizes it's not ideal, but they're getting used to it. The teachers are doing a really good job compared to the spring when things were more challenging. I think the teachers have really developed a flow and a process for the distance learning. I would add to the discussion too that I would look at it differently if we were talking about distance learning strictly and not distance learning plus. That I think the district has done a really good job of supplementing distance learning with the students that are struggling, giving those opportunities to bring those kids in for individual help, that kind of thing. I happened to walk through the living room today when I was hearing my son's teacher talking about it. She was inviting them in to talk about a special project they're doing, if they need extra help, if they need an adult guidance, if they just need to have some questions answered. There's all kinds of opportunities for that on a small group level to do it safe and to do it with social distancing, but those opportunities are being offered, and I really hope that our students, particularly at the secondary level, are taking advantage of that. Just one more thing to add to the discussion, that again, I referenced earlier the CDC article. My close reading of that article was talking about our younger students, which is different from our secondary students. I think that's important to keep in mind. And again, finally, the consistency that we talked about before, both with all our elementary students and our secondary students. I think that's key to what we're going to do next.
Thank you. Dr. Garcia, did you have something to say?
I did, but my colleagues have, I think, touched on a lot of it. I think one of the aspects for me as well is clearly we thought offering the social option of sports would help kind of mitigate maybe some of the mental health and the social emotional well-being of the students, but that has created a lot of spread. And so I think that that's another thing too that some of the teachers are concerned about, that even if just that, where we were sort of told that the coaches were going to be taking special care to prevent some of the transmission, and they were going to be following protocols, that in those cases where that might actually have been happening or not, there's still quite a bit of increase in cases there. And so if we go full-time in person, everyone's back, obviously the likelihood that there's going to be increased spread within the schools in the buildings is also pretty high. I think a number of teachers also being explicit about those students who have special needs, the full in-person or the promise of a full in-person rather than the scariness and inconsistency of a hybrid, particularly for those who are either homeless or do not have stable housing, that a date to also move full-time in person is something for them to kind of, work towards, again, rather than the inconsistency. And I think a lot of the teachers and some parents have made pretty clear their preference that one or the other is better than the in between. And I would just like to say that what into some of my thinking the first time we had this vote was like maybe hybrid would be a nice in between. But it just seems to be more complicated, I think, for people at this point.
Thank you. Ms. Amundsen.
I want to express appreciation for having a backup proposal, because I was having a difficult time with a second, even just for the purpose of discussion, because I feel like the numbers don't indicate that we're quite ready for secondary, based on governor's guidance and public health guidance and all that type of thing. But we do need to move toward it. I'm questioning whether or not, if we're pushing it that far out, whether there's sense in passing a resolution now, knowing that things can change, and again, that whiplash yo-yo effect that we were talking about. But I'm not opposed to pushing it out. But I would like to talk about, in the interim, if we do agree that the beginning of fourth quarter is a rational, reasonable, logical starting time that allows everybody to do it and do it well, which I get totally behind. I heard mention of other things that would be happening for secondary in the interim, such as the orientation for 6th and 9th graders, and other types of opportunities, whether that be for school community, sense of community, or maybe somebody could jump in and paint me and the rest of the people listening a picture of what we could do for our secondary students between now and the beginning of fourth quarter to address the kinds of concerns we're hearing about how social and emotional needs are suffering, other than, of course, the excellent resources that we've highlighted, that our competent staff has highlighted. But the social opportunity types of, not just the people in crisis, but sort of the next step down, people who are suffering but not necessarily in crisis.
Right.
So for those who thought through that, could we hear a little bit more about that?
Well, if that's the will of the board, we certainly can. Part of the messaging we were getting from our staff was that they were committed to working on those things. They offered a couple of suggestions, as Ms. Nathan said, getting kids the opportunity to physically be in their building, capitalize on opportunities to experiment with additional targeted in-person experiences, for instance, a sports biofield trip, anatomy and physiology labs, the kind of things where small groups of kids could be brought in, tour the building, get into a lab, do that type of thing. But the commitment was there from the staff to make that work on a building by building basis. And I'm hoping that for the time being that's enough, because that's one of those things that they would be working on over the next 2 months to try to implement quickly, but continue to build towards that. Mr. Barlow.
Yes. Well, I'm curious, and this perhaps goes to the superintendent and slash cabinet. Our respective roles of governance and management, we're as a board saying, yeah, staff communicated to us this and that. I'm curious, superintendent, cabinet, the things that we're sharing with you that staff has communicated to us that we think is such a great idea, has any of this been communicated to you, superintendent and or cabinet? And how did that factor into the recommendation that was originally placed into as a resolution this evening.
Yeah, we did receive the same communication you did from staff. I will tell you, I do know our secondary principals, before even we received the communication from staff, they already were brainstorming on ways to transition 6th grade and 9th grade into the buildings, because they haven't stepped foot in that building this school year yet. So some of this planning's already been having some conversations, maybe not to the point where they've identified the specific details of it, but that's some of the conversations that they've been having during this planning process.
More specific to the time frame or concept of distant learning versus full in person?
Well, I would say we would all agree that no matter if you're talking elementary or secondary level, hybrid model is extremely difficult to do. Not only for staff, but I think it's difficult for parents, especially elementary parents. And so I think we would agree with that. I think, way back in the fall when we started this whole conversation, and I think even Graham even made a comment, I don't remember his exact words, is that there's no perfect one answer to this or solution. There's always a risk. I mean, if you bringing back in a hybrid model, there's still that risk, as he mentioned tonight. But then you also have to factor in what's the risk of not bringing students into the building. And you've heard a lot about the mental health concerns. So, I don't think there's that one answer or that silver bullet that will address everything. You just have to try to, based on everything try to make the best decisions for our students and staff and our families. And we can make this one work. Like I said, some of the, the planning for the 6th grade and 9th grades already been, already started. I think as we look vaccinations, hopefully we're hearing at the federal level that more vaccines will be coming out our way, hopefully in the near future, so we can get more of our staff vaccinated. And, we shared with you the results of the staff survey, and it's just, there's so many factors that you have to weigh here, and we make the best recommendation based on what we know, but knowing that there's risks and there's always things that you have to consider. And there is that risk that we could start something and things happen like they happened in November, and we have to pull everybody back to distance learning. So, I think they don't know yet what this new virus is going to impact. We do know it's in the state of Minnesota. We don't know how quickly it's going to spread, and is it going to spread? So, I mean, that's another factor you have to worry about. But, I think we could support the resolution as amended and make that work.
Ms. McLaughlin.
Chair Marvin, I just wanted to echo something you said when you were talking about the feedback from the student school board, that I took the same message from a lot of the teacher feedback and emails that we were getting. They characterized it more bluntly, I think, as a loss of instruction time, and that really stuck with me, is that that's the concern about hybrid, particularly going back from the block schedule to the 8-period day. With all the cleaning in between and the shorter time frames, all the students are going to lose instruction time in that model. And I look back at, I wasn't on the board yet when the board was looking at the bell time study and the decision about which schedule to use, but that instruction time was something that was very critical to the board's decision at that time. So I wanted to have some consistency in things we're looking at. The other piece that similar to that is I wrote down a quote from one of the teachers that I received that really resonated with me. It was a Century English teacher. She talked about curricular sacrifices that we'd be making if we went to the hybrid model. And that really, we don't want to be doing that for our students, that I think it's counterproductive. The final point I would make is that, as I understand it, that the hybrid model would be inconsistent with one of the governor's orders that not doing in-person and distance learning at the same time for the teachers, that was strongly recommended against. And I'd be worried again about the instructional value if we're asking our teachers to do that, how difficult that would be, and that it would not be very effective either.
Thank you for that, Mrs. McLaughlin. And I want to reiterate too that I think our goal is to get our students back and keep them there. And we know that our teenagers are spreading the virus more. If we have one secondary teacher who tests positive and has to quarantine, that person is taking out 150 students, because that teacher has 150 students throughout the day. And then it gets to be the ripple effect that can happen very quickly in a secondary situation. Any other discussion? Are we ready to vote? Okay, the resolution has been read. Ms. Severson, would you call the vote, please?
Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
Treasurer Workman.
Aye.
Thank you.
Motion passes. At this point, I have a question for Ms. Nestler. Ms. Nestler, you had a 5-minute note on the chat. 5 minutes until something. Is that significant of anything?
That wasn't me. I think it was just the timing of the meeting was only scheduled until 8:30.
Oh, okay. So we're not quite there yet. At this point, because you said 5 minutes, I would like to put us in recess for a 5-minute break. We will resume at 8:40. Order at 8:40 p.m. We are on agenda item 7.01, approval of bids and proposals of bid package number 1 for the new Harriet Bishop Elementary School. This is a briefing item. Mr. Munoz. Or Mr. Sheridan, if you're there.
Yes, I'm here. I'm also here with Kean McWaters from Knutson Construction.
Great, thank you.
And I'm here to seek approval of the bids and proposals for bid package 1 for the new Harriet Bishop Elementary School. On December 17th, a bid and proposal package was posted for the new elementary bid package 1. It included the precast package, a roofing package, glass and glazing package, plumbing and HVAC package, electrical package, and earthwork package. And all of those packages were to be decided upon during using a best value process. The remaining 28 trade packages were to be just based on competitive low bid. On the 21st, the trade packages, all of the trade packages except for the best value packages, were opened and tabulated. We got a pretty good response, particularly on the best value packages. We had 2 proposals for the precast, 3 proposals for roofing, 3 proposals for the glass and glazing, 4 proposals for the plumbing and HVAC, and 5 proposals for the electrical packages, and 5 proposals for the earthwork packages. All 6 proposal packages were blind rated by construction service members along with facility staff. They were rated as normal on their risk assessment, team expertise, and their value adds. And after that blind assessment, 2 vendors for precast, 2 for roofing, 2 for glass, 4 for plumbing, and 4 for electrical, and 4 for earthwork were moved forward to the interview phase. Over 2 days of January 25th, or 3 days, 25th through January 27th, the Construction Services Division and facility staff, we interviewed for the best value packages. Each of the interviews were individually rated and scored. The purchasing manager oversees that entire process, and he tabulates the scores for each package. And then he also assesses the bid costs, and through the scoring process, we determine who the highest rated is in the best value. At the time, we did not do the plumbing and HVAC interviews because apparently when those bid packages came in, their proposal packages came in, they deviated too far from what our proposed budget was, so we had to revamp the scope and design, which is currently under review, or was under review, and it just so happens that the HVAC and plumbing was interviewed this morning, but it's too late obviously to bring it to board, so we'll bring it to board hopefully at the next meeting. So in the best value process for the precast, Terracon precast was the best value at $2,561,223. Merit Roofing was the highest rated in the roofing process in the amount of $1,057,070. Ford Metro was rated highest in the best value process for glass and glazing, and MT Contracting was rated second highest. Ford Metro's overall price, however, was greater than the project budget and 10% higher than MT Contracting. So per the best value rules, this allows us to award to the lower of the 2 proposals, and it's all spelled out in the proposal package. So MT Contracting has been identified as the best value for the glass glazing in the amount of $828,444. Egan Electric was rated the highest in the electrical package in the amount of $2,001,690. Edge Contracting was rated highest in the best value process for the earthwork, and Fraser Construction was rated second. And since Fraser Construction's overall score was within 5% of Edge Contracting, again, the best value process allows us to treat those two as firms as equal and allows us to take the lower of the two bids, which was Fraser Construction in the amount of $1,572,300. All of the best value projects, the contracts are contingent upon successful completion of the clarification phase, which is carried on over the next coming weeks. And if they pass through the clarification phase, then they're awarded the contract. But we do need approval from the board to move on to the clarification phase. The remaining 28 packages all were competitive bids, and they're all listed in the board doc. I prefer not to go through all 28, but the competitive bid total was $11,795,171. So the overall total for bid package 3 with everything is $22,979,000, and this includes $3,163,102 for the construction manager agent general conditions, and that's the remaining cost for the bid pack for Harriet Bishop. There were some alternates in bid pack 3. Alternate 1 was for 2 additional classrooms. Right now we're going to hold off on that alternate and decide at a later date. Alternate 2 was to provide Raskin LVT in lieu of Patcraft LTV. The bids received were for a total of $15,000, and again we'll bring that up at a later date, along with alternate 3, which has to do with the PVC piping in lieu of cast iron piping at the above grade storm sewer piping. So we'll bring those decisions probably at a later date once we decide on alternates 1 through 3. I think I've covered pretty much everything on that for bid package 1.
Mr. Sheridan,
yes.
I think I speak for the entire board when I thank you and Mr. McWaters for the very thorough job that you do, and also to express our deep disappointment that you didn't want to speak to each of the 28 competitive bid packages, because I'm sure that that would be scintillating, but thank you. Okay, other questions, board members? Mr. Sheridan, you said that you were anxious to get this moving.
Yes, to stay on schedule, it's important that we stay on the timeline if the board is willing. Yes.
Mr. Barlow, I saw your lips move.
Move for approval.
Thank you. You just moved it to action, right? Good. Thank you. Perfect. Is there a second?
Second, Garcia.
Thank you, Dr. Garcia. It's been moved and seconded to move this to action. Ms. Severson.
Thank you. Clerk Amundson?
Aye.
Director Barlow?
Aye.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
And Treasurer Workman?
Aye.
Thank you.
This is now an action item. Be it resolved that School Board of Independent School District 535 does hereby accept the best value proposals for precast package proposal 3F from Terracon Precast in the amount of $2,561,223. Roofing package proposal 7A from Merit Contracting in the amount of $1,057,070. Glass and glazing package proposal 8B from NT Contracting in the amount of $828,444. Electrical package proposal 26A from Egan Companies in the amount of $2,001,690. Earthwork package 31A from Fraser Construction in the amount of $1,572,300, and 28 competitive bid packages in the amount of $11,795,171. Be it further resolved that the School Board of Independent School District 535 does hereby approve the Knutson general conditions for the sum of $163,102 for a total cost of $22,979,000.
Move approval, Workman.
Second, Amundson.
Thank you. It's been moved and seconded. Ms. Severson.
Thank you, Clerk Amundson.
Aye.
Director Barlow.
Aye.
Director Garcia.
Aye.
Director McLaughlin.
Aye.
Chair Marvin.
Aye.
Vice Chair Nathan. Vice Chair Nathan.
Kathy, you're muted.
I think
she might be frozen. She might be frozen.
Too.
Treasurer Workman.
Aye.
Thank you.
And I think Ms. Nathan's back.
Vice Chair Nathan.
Aye.
Thank you.
7.02, approval of precast proposal for the new Longfellow Elementary School. This is a briefing item. Mr. Sheridan.
Thank you. I also have Kian McWaters from Knutson Construction with me on this, if there's any questions. This is seeking approval of the proposal for the precast package 3F for the new Longfellow Elementary School. On January 7th, the proposal package was posted for the precast package for Longfellow, the new Longfellow, and it was to be a best value proposal. On January 26th, the best value packages were received and managed by the purchasing manager of the district. We received 2 proposals. They were blind rated by members of construction services as per usual, based on risk assessment, team expertise, and value adds. On the 27th of January of this year, the construction services division interviewed the 2 firms, and interviews were blind rated and scored. The purchasing manager once again tabulated the scores and also assessed the bid cost to determine the rated highest in the process. Wells Concrete was rated highest in the best value process in the amount of $2,975,725, and Terracon Precast was second highest in the amount of $2,323,507. Terracon was rated within 5% of Wells Concrete on their overall score. And again, the RFP, the best value process, allows Rochester Public Schools to treat both of them in that instance as equal and select the lower of the 2 bids. And again, these we're moving forward Terracon Precast in the amount of $2,323,507, and this is based again, if it's approved tonight, then we have a clarification phase, and that's the next step that they move on to. They are not awarded a contract until they pass the clarification phase, which may be a week or 2 from now, but that's when it becomes final in a couple of weeks. I'll entertain any questions you may have on that.
And Mr. Sheridan, are you seeing any kind of need to get this moved along?
Yeah, as Kian can attest to, we have a fairly tight schedule on this, and we move fairly quickly. As you can see, when the packages come in, we immediately do interviews because we try to meet these timelines that have been set out. And we appreciate the board's willingness to move these to action as we bring them forward. But we certainly understand if you have a hesitancy to that, but we certainly appreciate it when you do move them to action.
Thank you. Ms. Workman.
Yes, I would like to move this item to action.
Second, Amundson.
Thank you. It's been moved and seconded to become an action item. Ms. Severson.
Thank you, Clerk Amundson.
Aye.
Director Barlow.
Aye.
Director Garcia.
Aye.
Director McLaughlin.
Aye.
Chair Marvin.
Aye.
Vice Chair Nathan.
Aye.
Treasurer Workman.
Aye.
Thank you.
This is now an action item. Be it resolved, the School Board of Independent School District 535 does hereby accept the best value proposal submitted by Terracon Precast in the amount of $2,323,507 for precast for the Longfellow Elementary School contingent upon successful completion of the clarification phase.
Move approval.
Move approval, Workman.
Been moved by Amundson and seconded by Workman. Ms. Severson.
Clerk Amundson.
Aye.
Director Barlow.
Aye.
Director Garcia.
Aye.
Director McLaughlin.
Aye.
Chair Marvin.
Aye.
Vice Chair Nathan.
Aye.
Treasurer Workman.
Aye.
Thank you.
Motion passes. 7.03, acceptance of proposal for the Northrop floor replacement project. And Mr. Sheridan, you have this one as well?
Yes, I do. And this one I'm doing by myself. This is for the acceptance of a proposal for Northrop floor replacement project. This is kind of a unique project. This was scheduled in our long-term facility maintenance plan that the school board approved on July 16th, along with the update that we provided in February of 2020. It was originally designated to have about a $20,000 price tag on it, but this was to work on the second floor. Once construction services got into the project a little bit, it became very clear to them that this project was going to be quite a bit more extensive than what we had anticipated, and this happens sometimes with our LTFM projects because we don't know what we don't know until we start digging into them, and this is a clear example of that. Once we started reviewing the amount of work that needed to be done here, the deterioration of the subfloor particularly was of concern, and it seemed to exceed, it was more than just tearing up carpet and putting down new flooring, because the subflooring had to be replaced, and since it was on the second and third floor, it requires a special assessment to do that. And so what we did, we determined that we needed to hire an architect to look into it for us. And so we hired ISG architects to do that, and they did the design on it for us on January 20th. Well, we posted for advertisement for bids with a due date of January 20th, and on the 20th we received two bids. One was from Knutson Construction, who was the low bid at a cost of $195,000 to complete the project. And they also, because of the unknown conditions that they still aren't quite sure they're going to know about till they get in there, they did provide unit pricing for us as well for the different types of structures and subflooring that would be underneath the flooring if needed. And so they provided unit prices, numbers 1 through 4 in the board docs for each type of subfloor as well. And of course, since the bid was over $175,000 per state statute, we're bringing it to the board for approval. The intent is to start this project on or about June 14th, hoping to get it completed on or about August 13th. And like I said earlier, this project will be funded with long-term facility maintenance revenue funds.
Thank you. Any questions for Mr. Sheridan? Ms. Workman.
I was going to ask Mr. Sheridan when Northrop was built, but I know you don't have that information at your fingertips, anticipating every possible question we might ask. But I would like to point out that this is one of our older buildings, and I appreciate the fact that the district is really staying on top of the maintenance and structural characteristics of this building so we can continue to use it as we have been. So I really appreciate that you have such a, I was going to say, such a fine eye on the details of how our buildings need to be preserved rather than having it fall down and having to build something new. So thank you very much for this report, and I look forward to seeing the completion of this work. Thank you.
Thank you.
And
I'm going to move approval on that note.
you're going to move it to action.
Move it to action.
Thank you. Perfect.
Second, Workman.
Good. It's been moved and seconded to action. Ms. Severson. Ms. Severson gets emotional when we're talking about flooring, so she's trying to compose herself right now. I cheered up myself a little bit right there. I mean, it was a moving presentation.
Thank you. One of my best.
Yeah, it was. And without key in there, so that was really something.
I'd like to call attention to myself. Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
and Treasurer Workman. Treasurer Workman?
Aye. I was on mute. Apologize. Aye. Aye.
I understand. Thank you.
Okay, this is an action item. Be it resolved, the School Board of Independent School District 535 approves the bid from Knutson Construction in the amount of $195,000 for the flooring replacement project at North River Community Education Center. Ms. Severson.
Move approval. Workman.
Oh, sorry.
Second, Tam.
Second, Nathan.
Moved and seconded. Thank you. Ms. Severson.
Thank you. Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
and Treasurer Workman.
Aye.
Thank you.
Motion passes. 7.04, 2021-2022 Longfellow calendar. Mr. Munoz.
Yes, if you remember, the board recently approved the 21-22 calendar. Once we have that calendar approved, we work with the administration at Longfellow to adjust that calendar to fit their 45-15 schedule. So we're asking for your approval tonight. Longfellow with a start date on July 27th, 2021. Last day of school would be June 9th, 2022. And there are 3 professional development days built in that calendar: August 25th, November 5th, and March 4th.
Thank you. Do we, any questions from the board?
Superintendent, just for the benefit of the community, do we have to get special approval from the state on the Longfellow calendar because it's 45-15?
Yes, not every year. It's either every 2 years we have to put in an application to do that. However, there is some legislation to try to avoid us not having to do that anymore, so hopefully that'll pass.
Well, let us know as a board if there's any legislators you'd like us to contact when the time comes.
Okay.
All right, and this is a briefing item. But I bet Longfellow would like to get this sucker going.
I'd like to move this item to action.
Oh, it's sort of twin move to action.
I'll second and let
Thank
Director Workman move it to action.
Thank you.
Yeah, because I haven't had a chance yet tonight. Thank you.
Ms. Severson.
Thank you. Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
and Treasurer Workman.
Aye.
Thank you.
This is an action item. Be it resolved that the School Board of Independent School District 535 approves the 2021-2022 calendar for Longfellow 4515 Elementary School.
Move approval, Workman.
Second, Amundson.
It's been moved and seconded. Ms. Severson.
Thank you. Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
Treasurer Workman.
Aye.
Thank you.
Motion passes. Our 7.05, this is an action item. I'm going to read the resolution or read the statement, and then I'd like you to just stay on your screens, and we'll talk about how we're going to conduct this meeting. This meeting will now be closed at 9:07 p.m. as permitted by Minnesota statute and is required to be closed in Minnesota statute 13D.03 to discuss labor negotiations. Ended the portion of this meeting that was closed. Ms. Amundson, will you please state the names of the closed session attending members?
Yes, the members present were board members Melissa Amundson, Don Barlow, Jessica Garcia, Jean Marvin, Karen McLaughlin, Kathy Nathan, Julie Workman, plus Michael Munoz, Superintendent, and Carl Bakken of Human Resources.
Thank you. Let me read the resolution. Be it resolved, the School Board of Independent School District 535 does hereby ratify the 2020-2022 collective bargaining agreement between the Rochester Public Schools and the Teamsters Local 320 maintenance employees.
Move approval, Workman.
Second,
Nathan.
Second, Garcia. Okay, thank you. Ms. Severson.
Thank you. Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
Treasurer Workman.
Aye.
Thank you.
The motion passes. 7.07, naming the new elementary school building. This is an action item. Mr. Munoz, do you want to speak to this or no?
No.
We have before us two resolutions. One is to select the name of Henry Plummer. The other is to select the name of Overland Elementary. My thinking on this is that I will read the first resolution, which is an action item. If it is moved and seconded, then we can have discussion about this one, and then we can move to the next one. Be it resolved that the School Board of Independent School District 535 select Henry Plummer Elementary School as the name for the new school. Hearing nothing, it's not been moved. That resolution, which hasn't become a motion yet, fails. I'll read the next resolution. Be it resolved that the School Board of Independent School District 535 select Overland Elementary School as the name for the new school.
Move approval.
Second.
It's been moved and seconded.
Who's the second?
Mr. Barlow. No, Ms. Nathan seconded. Discussion.
Yes. I think we asked the public for input, and they provided and then I'm unsure as to exactly what we do, but we have the two that had garnered the highest number of votes, if I understand the process correctly. It matters not what our opinions or thoughts were, because that was the process we followed. And I think we shouldn't go out of our way to alienate the community. We should show every indication that we're supportive of their input and that it's valued. And so I will stand in support of the resolution before us.
Thank you, Mr. Barlow. Any other comments or discussion? And I should remind us too that the next issue on our agenda is to determine or to talk about a process for naming the new middle school. Anything else? All right, I read the resolution that would select Overland Elementary School as the name up for the new school. Ms. Severson, will you call the roll?
Thank you. Ms. Amundson?
Nay.
Director Barlow?
Aye.
Director Garcia?
Nay.
Director McLaughlin?
I'm going to abstain.
Can you state your reason for abstention, please?
I simply choose not to vote on this particular issue.
Chair Marvin?
Aye.
Vice Chair Nathan?
Aye.
And Treasurer Workman?
Nay.
Motion fails. We have a 3-3 tie with one abstention.
Chair, point of inquiry. I thought an abstention was to be considered in favor of, not necessarily. I guess I'm looking for clarification. How did the motion fail if it's 3-3?
No, Mr. Barlow, that's a good point. And my understanding is that if there's an abstention, it goes to the side of the most votes.
Right.
And with the tie, that's a tough one.
My understanding is that it doesn't move forward unless it gets a majority. It doesn't pass unless it gets a majority. If it's 3-3, it's not a majority.
Right.
And so I think it did not pass. It didn't necessarily fail either, but by default it fails.
Well, I'm sorry. Go ahead, Chair Marvin.
No, give me 1 minute. Talk amongst yourselves.
Well, should we call a recess? I was going to say, but.
All right, I'm back. All right, the motion did not pass. I suggest that we revisit this at our next meeting. 7.08, naming the middle school process. This is a discussion item. It's to determine the process for naming the new middle school. My suggestion would be, rather than having that discussion now, that we appoint a subcommittee to come up with a process and bring that process to the board at the next board meeting. Just how would that look? How will the process look? Not to come up with names, but just to suggest a proposal for the process we could use. Dr. Garcia.
Was that also done for this last elementary school name decision making?
My understanding is it was not. Okay. That the board did not come up with the process.
So how, I guess, obviously this predates us, and I'm, for some reason, I'm not recalling how this happened. I remember getting sort of notification on social media to submit a name and then vote, but how did we get to submitting anything out to the community for, to elicit their opinions or votes?
Yeah, Superintendent Munoz, do you want to speak to that?
Yes, I don't have the exact date and when the meeting, but the process was presented at a board meeting, and there was no, at that time, there was no discussion that we didn't like the process. That didn't happen until the results were brought back at the most recent meeting, but the process was presented at a board meeting. We heard no objections, so we moved forward.
Right, so I think I don't disagree with Director Barlow. The community did what we asked them to do. I think my concern is when we were reading through everything, it was 400 names or so, were submitted, and it was a very small number of people who submitted. It was like 1,000 or 1,100 people who offered kind of initial impressions, which is not at all representative of our larger community, but it is representative, the options that we were given is representative of the small group that voted. And I just worry that that's something that we are becoming notorious for, is that there are small groups of people that have the resources in which to be heard in a way that others maybe don't. And then we're left with very constricted options. So if we are going to develop a subcommittee, my preference would be that we take great care in not just putting out a communication to the community that we want their feedback or that we want them to provide us options, but that we actually get up and go to the communities that we need to be hearing from, because they're obviously overwhelmed. We're only having these meetings in English, so other people who may not have the ability to be listening to this either in their first language or don't have devices, et cetera, we're not going to reach them by waiting until our next meeting or developing a subcommittee about what process, unless we're actively including them. And we are doing the reaching out. So I'll get off my soapbox.
No, and I think that what you just said is an important message for whomever is on the subcommittee. So thank you for that. Ms. Amundson.
My question about the formation of a subcommittee is how does that fit into our timeline? What is our drop dead date to have a decision for the middle school?
Mr. Munoz.
Well, I just want to make a comment before I answer that. We did involve our bilinguals, and we did translate it into other languages. So we did not do focus groups like you're suggesting, but there was effort put out to do that. I would have to check with Keenan on the timeline. I know the timeline to get the new elementary, they were a little concerned about delaying it to even this meeting, but we'll have to make it work. We may not be able to get the name on the school by next fall, but that's fine. It's actually going to be used by a different group of students anyway next year. So, but we would have to check with Keenan on the timeline for the naming of the new middle school, and we can get back to you.
Ms. Amundson.
If we don't have a really firm date on the middle school, but it's opening a year after the elementary school, and this is a really late date for naming the elementary school, I'm wondering if it wouldn't be logical to assume that we have at least into May of this year. And would that be enough time for a subcommittee to do its work? And I would put forward that it would. So I would support the formation of a subcommittee pending the answer of the deadline, making sure that the deadline that we receive would not eliminate that as a possibility.
Okay.
Committees take time.
We have two issues here. One is we still don't have a name for the elementary school. So we're going to have to figure out how we move forward with that. And secondly, my suggestion was that we get a committee to come up with a process for naming the new middle school. Not to conduct the thing, just go ahead.
I'm supporting your recommendation for the committee, but I couldn't support it until I heard the answer of how much time do we have to consider the middle school name. Because if we're going to have a committee, it's going to slow things down, which may be acceptable since we have the additional time. That's all I was saying.
Okay.
Regarding the elementary school, would we not need to have a motion to reconsider to talk about that again? Because we're on the middle school process right now.
Right.
And I would make that motion when we conclude this, if so desired, so that we could discuss it again. But meanwhile, I support your recommendation to form a committee.
All right. And then I'm hearing that you want to reconsider 7.07, the naming.
I haven't made the motion, but I would be willing to do so if it were advisable.
Go ahead. Yep.
But we should conclude the middle school discussion.
Well, this was just a discussion. That's all this was. The middle school thing was just a discussion. There was no action necessary.
So I see a couple of hands up.
Okay, Ms. Nathan.
All right, I just want to be clear, because when we have created committees previously for other reasons, like the superintendent evaluation or the agenda, we made a motion to create an ad hoc committee of the board on this topic. So that's my first question, is do we need someone to make a motion for that so that we can make it official? The second question I have is, I want to be clear that whatever this group of board members is going to come up with the process for identifying a name, not carrying out that process themselves.
Exactly right, about the process only. And my thinking on this is that because the process for naming the elementary school was predetermined, it was presented to the board, we didn't vote on it, it was just something that people thought was going to be very workable. That my thinking is that our subcommittee doesn't need to be a formal decision that we vote on to have a subcommittee. Just come back to us with an idea. We'll like it, we won't like it, but just to come up with something. And let me quickly go. Mr. Sheridan, you had your hand up, I think.
Yes, I did. Keen McWaters was kind enough to respond to a text. He said they would need the elementary school name by April 1st in order to have enough lead time to get the lettering and all that.
Okay.
For the middle school, they would need it by December.
Okay.
So that's the time frame.
Thank you. Thank you. Yep, now Ms. Amundsen, you wanted to, well, at this point, we're still talking about the process we're going to use for naming the middle school.
I was going to follow up on Director Nathan's clarification about forming a committee. Would we then, as a subcommittee, present that recommendation for a vote by the board? Would we then vote on the proposal that is finalized?
I guess that would be my my thinking on it. Mr. Barlow?
Yes. I tend to think that at least we run into the problem being inconsistent, perhaps the development of a policy versus, well, for this school or for that school. If we had a policy, then the policy would dictate the procedure. Could we not allow the policy committee to do its work? And there are a number of districts throughout the state, and maybe even contacting MSBA, that may already have a policy in naming schools. I don't know why we're making it more, at least to me, awkward, difficult, cumbersome than what it needs to be. Just a thought.
Ms. Nathan?
Aaron's hand.
Okay. Yeah, Scott, you have something else?
No, sorry.
Okay. Dr. Garcia.
Oh, I'm sorry. We're having a discussion about Robert's rules, and kind of going back to what my colleague was mentioning is, we made the process already. We asked them to do what we asked them to do. They did it, and we need to vote. And now there's a discussion about whether an ex officio member who, per Robert's rules, is allowed to vote. I don't know where in the board's history ex officio members. The ex officio member was decided they could not vote, and then there's also a question about whether school board members are allowed to abstain if there's not like a conflict of interest. So our original vote, I suppose, may also not be valid now.
Yeah, I think you have a point there. I am wondering if, for the purpose of time and sanity, if we can table this discussion until our next board meeting and have it as an agenda item on our next meeting, and hopefully I will have a more specific recommendation, or we'll put more thought into this so that we can efficiently come up with the process, whether it's policy or a committee that we vote on or some other method of doing it. But I think right now we may be spending time that could be better used doing something else. Is there any objection to that? Ms. Amundson?
Well, my original recommendation was that we just take a short recess to get the answers to those questions, but I am not opposed to, it wouldn't be called tabling, it would be postponing till the next meeting. And so I wouldn't be opposed to that either. Either one is fine with me if we do a quick research, and I am still willing to make a motion to reconsider, but whatever the will of the board is, it's okay with me.
I think at this point, because there are a few questions about the rules that we are following, the process we used for this vote, that I would feel more comfortable if we could postpone this till our next board meeting. And do we need to vote to postpone? We do. You think?
No, not if this was just a discussion item and there was no resolution attached to the discussion.
All right. Let's just move on. Are we okay with that, Kathy?
Yes.
Okay.
Can I say?
Yes.
No, never mind. No.
All right.
Because we still haven't made the decision whether we're going to have a committee of the board, right?
Right.
Okay.
Okay. I'm going to read this next thing, and then I want everybody to keep their cameras on. We're going to have to switch to a different venue. We're at 7.09. This meeting will be closed at 9:40 p.m. as permitted by Minnesota statute for preliminary considerations regarding allegations against an employee. We will stop recording the open meeting at this time. We will now resume our regular open meeting at 11:11 p.m., noting the following members that attended the portion of this meeting that was closed.
Board members Melissa Amundson, Don Barlow, Jessica Garcia, Jean Marvin, Karen McLaughlin, Kathy Mason, Julie Workman. Others present were Mick Waldsberger, attorney for the school board.
Chair Marvin?
Yes, Ms. Nathan.
I'd like to amend the agenda to act on an employee resignation.
I second that. Garcia?
Been moved and seconded. Ms. Severson, will you call the roll?
Who did the second? I'm sorry.
Dr. Garcia?
Thank you. All right. Clerk Amundson?
Aye.
Director Barlow?
Aye.
Director Garcia?
Aye.
Director McLaughlin?
Aye.
Chair Marvin?
Aye.
Vice Chair Nathan,
Aye.
Treasurer Workman.
Aye.
Thank you.
The agenda has been amended. I move to accept the resignation of Rochester Public Schools Superintendent Michael Munoz effective June 30th, 2021.
Move approval?
Second.
It's been moved and seconded. Ms. Severson, will you call the roll?
Clerk Amundson,
Aye.
Director Barlow,
Aye.
Director Garcia,
Aye.
Director McLaughlin,
Aye.
Chair Marvin,
Aye.
Vice Chair Nathan,
Aye.
Treasurer Workman.
Aye.
Thank you.
8.0 Other Business. Some information items. February 9th, 2021 at 5 p.m. is a school board study session. It's a pre-referendum survey. February 16th at 5:30 p.m. there will be a regular school board meeting. February 23rd at 5 p.m. a school board retreat involving the school board self-evaluation. Future school board discussion considerations include data needs, additional listening posts, process for naming the middle school, and determining the process to choose a name for the new elementary school. Any additions to that list? Hearing none, this meeting is adjourned at 11:14 p.m.